everyone. Good evening. So, I hope you all are doing well. A very good evening to all of you. So, today we are going to discuss the previous year questions specifically for the FMG aspirants, the previous year questions of community medicine. Now, community medicine is a major subject and you get many questions from this subject out of the 300 questions in your exam. So, I will try to cover the last 3 previous year questions of FMG in this session. Okay, so I welcome you all for today's session. I hope I'm clearly visible, audible, and this session is going to be super focused and super, effective for all of you. And you will get all, and most of the students already know my way of teaching. So today, whatever questions we will discuss, just suppose we will discuss 50 questions today. So I will not just discuss 50 questions. I'm going to discuss all complete topics. Because in your exam, it is not the exact question which is going to be repeated every time. It is the topic which is going to be repeated. The questions may be different. So whatever questions we will discuss that topic completely. So is it good to go? Everyone ready? Can I start? Community medicine. It's an important subject, major subject. And I guarantee you at the end of the session, you will feel much confident in the subject because all your PYQs are covered after that. So let's start it without wasting any further time. So this is the first question in front of you. You can read the question, give a guess what is the correct answer, and after that we will discuss. We will discuss that topic completely quickly. Okay, so the first question is in front of you. What is true about incidence? What is true about incidence? The 4 options are in front of you. Is it total number of cases in the community? Is it the number of risk patient, at-risk patient? It is the number of the new cases in the community, or is it number of death in the community? So what is the correct answer? Can you people guess, please? What is the correct answer? Yes. The correct answer here is the new cases. Absolutely right. So the correct answer is C. Most of you are right. So let me tell you all about the incidence. As I told you, whatever questions we will discuss today, whatever PYQ we will discuss today, so we will not discuss that question only. We will discuss that topic completely so that any new question created from that particular topic in your exam, you will be able to crack it. Okay, so let's start it. Do you know what is mortality and morbidity? We use 2 terminologies. Mortality and morbidity. Do you know the difference between them? What is mortality? What is morbidity? Mortality means death. It's an event. It's death. Okay. And morbidity means disease. Morbidity means disease. Okay. So morbidity. So how to measure the morbidity in a community? So let's take a community. Community is a geographical area. So this is a geographical area in which there is a population. Okay. This is a community in which a population is residing. Okay. Let's take any disease. For an example, let's take one disease. Take TB. You can take any disease. You can take blindness, cancer, any disease. So we are talking about one particular disease. For example, we are talking about tuberculosis right now. So in this community, what is the morbidity of tuberculosis? How to measure the morbidity? My question to you, what is the measure of morbidity? How you will measure morbidity of any particular disease in any particular community? We are having a community having a fixed population in that. Okay, you can see the population is there. Now, how to measure the morbidity inside this community? What is the measure? How to measure? You will see, ma'am, count the number of the cases of TB. We will go home to home and we will see where is the TB patient. So we will count the total number of TB patients in this community. That is the morbidity of TB. So whatever disease we want to see, the morbidity, we have to see the number of patients. You are absolutely right. You are absolutely right. But imagine there is a TB patient. Okay. Now there are 2 possibilities. Okay. This TB patient may be new, which is diagnosed in this year. Currently we are in 2023. We are just about to leave and enter the new year. So for example, this is diagnosed in 2023. From 1st January till 31st December, anytime this is diagnosed. So I will consider it a new case because it is diagnosed in this year. But maybe there is an old patient of TB which is not cured yet. Maybe the TB patient is from 2021 or 2022 and it is continuing till 2023. So there can be new patient, there can be old patient. The patient is there, but patient can be new, patient can be old. So there are 2 measures of morbidity of a disease which are known as incidence and prevalence. So if you are measuring only the new cases out of the total patients, out of the total population, the only new patient, that is known as incidence. And if you are measuring all current cases, the current cases include new plus old both. If you are measuring new as well as old, that is total current patient, that will give you the reflection of the prevalence. So there are 2 measures of morbidity of a disease. We are not measuring mortality. We are measuring morbidity. Morbidity means disease. Any disease you can say. How to measure a disease in a community? There are two measurements. You can measure the incidence of that disease. You can measure the prevalence of that disease. Now, what is the difference between them? I told you. So incidence, see the formula. Can you see the formula? So in the incidence, you can see the denominator is the population at risk. What is the numerator? It is the number of new cases. New cases from population at risk. And multiplier is 1000. Multiplier is 1000. So this is incidence. So incidence is a rate. Incidence is the rate. Okay. Incidence is the rate. And what is prevalence? What is prevalence? See the formula of the prevalence. Can you see the formula of prevalence? The denominator is still same. It is the total population at risk. But the numerator is total cases, current cases. That is new as well as old. And the multiplier is 100, not 1000. So it's a proportion. Prevalence is a proportion. You got it? So there are two things you have to learn. What is rate and what is proportion? In rate and proportion, in each of them, there is a numerator and there is a denominator. We have a numerator and we have a denominator. In both of them, the numerator is a part of denominator. The numerator is a part of denominator. But here the multiplier is 1000. It's never 100. It can be 1000, 10,000, 1 lakh, anything, but never 100. But proportion is always percentage. It is always 100. It is always 100. And here we have time multiplier also. It is usually 1 calendar year. But here we don't have any time multiplier. Okay. So rate and proportion. So I can say incidence is the rate because the multiplier is 1000 and the prevalence is the proportion because the multiplier is 100. You got my point? Can you tell me the formulas of both of them together? I will show you a few more questions based on that. Incidence and prevalence. So tell me the numerator and denominator in each of them. Can you tell me? The denominator is same in both of them. It is population at risk. It is population at risk. Here also population at risk. You can say total population or population at risk. What is the numerator? That matters. What is the numerator here? What is the numerator here? Here the numerator is the new cases. Okay. So the new cases are from this population only. They are not aliens. They are from this population only. So I mean to say the numerator is a part of denominator. And here the total cases. By total, I mean new plus old both. So new plus old both are the part of total population only. Again, the numerator is a part of denominator. But here is a catch. Here the multiplier is 1000 and here the multiplier is 100. Please take it in consideration. And here we use usually 1 year. We measure this incidence in 1 year. So we have time multiplier also. So can I say that incidence is a rate? Yes. And prevalence is a proportion. You get MCQs on this also. Please learn it. Please learn it. You got it? So this is the thing you have to learn. Okay. So out of the community, can you see the population in the community? You can see the colored people are the diseased. They all have TB, for example. But in the color, I have shown you two colors, the blue and the green. Imagine the blue one are the new cases and the green one are the old. So if you take only blue, that is incidence. And if you take the total colored blue plus green, that is the prevalence. I hope you all got it. We are not taking healthy people in consideration. We are taking the diseased people in consideration. The best diagram to understand the incidence and prevalence is this. Can you see this diagram? The best diagram you can understand. Can you see there is a tap from which the water is falling in a container? Can you see there is a tap? So the new water which is coming, the new water which is coming, it is incidence. So the falling water, the new water which is entering here, this water is incidence. After coming, it is mixing with the old water. So new plus old together. New plus old together is known as prevalence. So the water falling is incidence and the water in the container is prevalence. And these are all diseased people in the community. Now, whenever someone have any disease, there are only two options. If the person is lucky taking the treatment, the person will recover and again become healthy. And if the person is unlucky, person is not taking the treatment or the disease is very grave, the person will be dead. So there are only two options to come out of this container. The container is a group of diseased people in a community. Can you see the colored people? These all are diseased people. Now they all have only two fate. Either they will recover or they will die. Okay. So outlet is either recovery or death. So you can get an image based question. They can give you this image and they can ask you the labeling. They can ask you the labeling here. Got my point? So tell me, what is this one? What is this one? And what is this one? So let me label. So what is the falling water? What is the total water? And what is the outlet? So the falling water is the incidence. The total water is the prevalence in the container. And the outlet is recovery or death. I hope you all got it. Give me a thumbs up, everyone. Give me a thumbs up, everyone, if you got it. If you have any doubt, please write down specifically in the chat box. Got it? So this, you have to understand this diagram also. Okay, so we have learned incidence is a rate and prevalence is the proportion, and we have understood it. So what is the summary? We have seen two measures to measure the morbidity of a disease. If you want to measure the morbidity of a disease, you have two ways. You can measure the incidence, you can measure the prevalence. Incidence, new cases, prevalence, total cases. Incidence is the rate, prevalence is the proportion. You know the formula of each of them. Here the multiplier is 1000. Here the multiplier is 100. Okay, got it. This is measured in cohort study. This is measured in cross-sectional study. I will teach you the studies also, don't worry. So please learn it. Please learn it. Okay, please understand and learn it. Now, what is the relationship between incidence and prevalence? So there is a formula. Formula is in front of you. Prevalence is equal to incidence into duration of disease. This is the formula. What is the formula? Can you tell me the formula? What is the formula? Prevalence is equal to incidence into duration of disease. This is the formula. This is the relationship between incidence and prevalence. You all can see this is the relationship. You got it? Say yes if you all got it. Huh? So can you see the prevalence is depending on the incidence as well as duration. Okay. So let me ask you two questions here. Prevalence is equal to incidence into duration. The formula is in front of you. Okay. What is the effect? What is the effect of treatment on prevalence? And what is the effect of any vaccination? What is the effect of vaccination? If you're doing the vaccination or immunization, what is the effect of that on prevalence? I'm asking on prevalence. Let me give you the three option. Here the three options are prevalence will increase, decrease, or same. Here also you have the same three options. The prevalence will increase on giving vaccine, decrease on giving vaccine, or remain same on giving vaccine. So can you answer? First answer for the treatment. First answer for the vaccine. What happens if you're giving a vaccine to any person? Hana, I'm a person, you are giving a vaccine to me. For example, you are giving a COVID vaccine. I don't have COVID, you're giving the vaccine. The purpose of the vaccine that we don't have that disease, but we do not want to have it in future also. So it is a preventive measure. We don't have that disease. Hana, I don't have TB and you are giving me BCG. Okay, so that in future also the newborn do not have BCG. If the newborn is given OPV, we do not want the newborn to have polio in future. You got my point? So by giving vaccine, we are reducing the incidence of the disease. The new case will not happen. The new case will not happen because you are preventing it. So the incidence is falling. Okay, so prevalence will fall because prevalence is directly proportional to incidence. So vaccination will reduce the prevalence. No confusion. Vaccination will reduce the prevalence. Everyone can understand. On giving vaccine, you are preventing the disease. Hana? If you have given vaccination to everyone in the community, so no one will fall ill. Hana? No one will have that particular disease for which you have given the vaccine. So the incidence, new cases will not there. Incidence will fall. Prevalence will automatically fall. So that is very simple. But there is a catch. The catch is in the treatment. Can you tell me what is the impact of treatment on prevalence? The three options are in front of you. Now let's see who is telling me the correct answer. Is the prevalence will increase on giving treatment? Is the prevalence will decrease, falling on giving the treatment? Or will it be same on giving the treatment? And you have to tell me the reason also. Yes, I will definitely share the PDF after the session. Don't worry. Okay. Yes. Charanjeep, your concept is right, but there is a small, catch is there. So it is same. Prajakta, why it is same? You have to tell me the reason also. You have to just tell me the reason also, whatever is your answer. Okay. So tell me the correct answer. The correct answer, it can increase also, decrease also. Most of the students are saying it will fall, but it can increase also, decrease also. Let me tell you, there are two types of diseases in this world. There are two types of diseases in their world. The first type of diseases are curable, for which treatment is available. The second type of diseases are non-curable and they are chronic. Non-curable, they are chronic. Can you give me the examples of non-curable chronic diseases? Some non-curable chronic disease. Can you give me example? Diabetes. How many of you have diabetes patients at your home? Maybe your parents, grandparents, or any relative? There are many diabetics in this world. Hypertension. There is no cure for diabetes. There is no cure for hypertension. We give the treatment just to control it. So because there is someone diabetic at our home, in our patients. There is someone hypertensive in our contact. So we give them treatment, obviously we give them. But by giving treatment, what actually we are doing? We are not treating the disease. We are just prolonging the diseased people on this earth. We are prolonging the life of diseased people on this earth. If we don't give the treatment, they will die. They will have the complication. The patients will have the complication and patients will die. We do not want the patient shall die. They have the complication. That's why we are controlling the disease. So by giving the treatment, we are increasing the duration of diseased people on this earth. We are increasing the duration of diseased people on this earth, on this planet. Okay. And what about the curable disease? Curable disease. Here you give the treatment. Now you reduce the duration. You reduce. Just suppose someone is having TB. If you don't give the treatment, it will be there for 2-3 years. But if you give the treatment, it will be treated in 6 months. So by giving treatment, here you are reducing the duration. Here by giving the treatment, you are increasing the duration. So the formula of prevalence is equal to incidence into duration. You got my point? So in curable disease, you are reducing the duration, so prevalence will fall. But in non-curable disease, you are increasing the duration, so prevalence will rise. है ना? So what is the effect of treatment on prevalence? Huh? You say, ma'am, prevalence can increase also, prevalence can decrease also on giving treatment, depending what is the type of disease. How many of you got it? How many of you got it? It was a difficult concept, but I tried my best. Can we go to the next question? Everyone give me a thumbs up. Can we go to the next question? Kindly give me a gesture that you got it. Otherwise, ask your doubt. Can we go ahead? Huh? Everyone got the concept of incidence and prevalence. So the next question is in front of you. Ultra important question. Okay, not ultra important question, ultra important topic actually. Many questions are repeated from this topic, the quality of life. So read the question, guess the answer, and we will discuss it. Okay, so the question is HDI. HDI include all of the following except. What is HDI? Human Developmental Index. What are the components of Human Developmental Index? If you know the components, you can tell me what is not a component. They are asking the except. So the four options are in front of you. The four options, it is real GDP per capita, life expectancy at birth, mean year of schooling and expected year of schooling, and range is 0 to 100. So what is incorrect among them? They are asking false. What is false or incorrect? So of course, most of you are right. The correct answer is D. And it's a confusing topic. Okay. So let me ask you a question. Okay. For example, there are two communities or two countries. Okay. Let's say country A and country B. Let's say country A is India. And let's say country B is US. Okay. Any two countries, any two geographical areas are there. Okay. People are residing here also. People are residing here also. So let me ask you a question. The quality of life. Which country have better quality of life? Huh? This one or this one? How to compare? There should be a objective criteria to compare them. Na? We cannot say ki subjectively this country have a better quality of life or this country have better quality. We cannot say that. We cannot say that. We should have a criteria to define that. So let's discuss quality of life. So what are the factors on which quality of life depends? Huh? In which country you are residing? Hai na? In which geographical area you are residing? Your quality of life depends on that. Got my point? Got my point? Can we go ahead? Huh? So let's discuss the factors. You know how many measures are there to measure the quality of life? There are 4 measures. We will discuss all 4. Currently the question is on HDI, but we will measure all 4. We will discuss all 4 because frequently you get questions on them. Okay. So what are the 4 measures by which we can measure the quality of life of a person in a particular country? The first is PQLI, Physical Quality of Life Index. PQLI. Learn the full form. It's Physical Quality of Life Index. Okay. The second is HDI, Human Developmental Index. HDI. The third is HPI, Human Poverty Index, which is opposite of HDI. And last is Multi-Dimensional Poverty Index. So we will see the components 3, 3, 3 and 3 components of all of them. So you have to see the difference. Okay. And what is the values in India? Okay. And in the end, we will make a tabulated table to compare all of them. Quickly, we will do so. Can I start? So the first one, we are discussing these two together. PQLI and HDI. Okay, PQLI and HDI. Okay, so we will be discussing the first two, PQLI and HDI. So this is HDI. Say the full form, Human Developmental Index. And this is PQLI, Physical Quality of Life Index. Okay, so there are three factors, three components in each of them. The first component is longevity. Okay, so this is, for example, what is the life expectancy of a newborn born in a country? Okay, for example, this is India and this is US. This is country A, this is country B. Today a newborn is born here and today a newborn is born here also. So we are expecting, this is not reality. We are expecting. What is the life expectancy of this newborn if the newborn is residing in this country throughout the life, not moving anywhere? So what is? So we have to apply the current mortality and morbidity on this person. The current mortality and morbidity values on this person, and we have to see what is the life expectancy. Okay, and we have to see what is the life expectancy here. So the first factor is the life expectancy. It is an expectancy, it is not reality. Please understand. Hana, just suppose here we are expecting the person will survive for 70 years. Here we are expecting that the person will survive for 80 years. Maybe the person dies before that. Maybe the person dies after that. It is an expectation. It is an expectation. So here we are taking life expectancy at birth. It is known as life expectancy at 0. 0 means birth, at birth. How many years the person, the newborn is going to survive? That is the first factor. Because I'm saying now there are two countries, A and B. This country have better quality of life as compared to other countries. So here people will survive more. And here people will survive less. So that is the life expectancy, the first thing we are taking in consideration. Okay. The second thing is the knowledge of that country. I'm not asking you the knowledge of one person. I'm asking you the knowledge of this country. The knowledge of this country. These are two countries, A and B. I'm asking you how to measure the knowledge. How you will measure the knowledge of a community, a country. How to measure? There should be a criteria to measure it, no? Huh? So everyone goes to school. Most of the people, they are going to school. Schooling. How many years of schooling are there? Here, how many years of schooling? Here, how many years of schooling? It is known as mean schooling years. Mean years of schooling. Okay. Mean years of schooling. How many years everyone is going to school? By school, I don't mean only school. I mean the college also. I mean the duration of the education. So most of the persons go for the education for 17-18 years. Okay, 2 for KG1, KG2, nursery, then first class till 12th standard, then bachelor's, then master's, like that. Okay, so this is mean years of schooling plus expected years of schooling upon 2. This is how we can measure the knowledge here also, here also. The formula is, what is the formula to measure the knowledge? Mean years of schooling and expected years of schooling. Mean year of schooling plus expected year of schooling upon 2. Here we are measuring the knowledge like this. And the third thing is income. Okay, income, GDP per capita. So which country have more income out of the two countries? Which country? Now see these 3 criteria here also, and then decide which country have a better quality of life. Hana? So this is the criteria which are given in HDI. Okay, HDI believe that money is a factor that decides the quality of life. The quality of life depends on the money, on the income, on the money. It's one of the factors. Got my point? So see the 3 factors. So longevity is measured by life expectancy at birth. Knowledge is measured by years of schooling. And standard of living is measured by income. Okay. Now let's see the 3 things in PQLI. In PQLI, income we don't take. We don't take income there. We take infant mortality rate. We take infant mortality rate. We don't take income. We take IMR. Okay, because PQLI people believe that money is not required for a good quality of life. Even without money, people can have good quality of life. So it is a group of people who believe that. So in in PQLI, the theory is even without money, people can have good quality of life. Okay, so here health is put ahead of the income. So here we are taking IMR, infant mortality rate. So there are 2 countries, country A and country B. We have to see the IMR. We have to see IMR. You know what is IMR? Infant mortality rate. So how many infants? Who is the infant? Who is the infant? Anyone who is less than 1 year of age. That is the infant. So how many infants are dying here in 1 year? How many infants are dying here? Suppose here more infants are dying and here less infants are dying. Why here more infants are dying? Because here health infrastructure is not good. Healthcare providers are not good. Good hospitals, good services, good doctors are not available. That's why in fact our infants are dying more. And here infants are dying less because here healthcare facilities are better. Got my point? So it is an indirect indicator. It is a best indicator that will reflect the healthcare facilities in that country. The country which is having good healthcare facilities is having better quality of life. I hope you all are getting it. Say yes. Can we go ahead? So that is infant mortality rate. Instead of income we are taking. Here we were taking life expectancy at birth, but here we are taking life expectancy at 1 year. Because we have already taken infant mortality rate now. Till 1 year we have included it. Now at the first birthday, at the first birthday of the child, we are expecting how many more years he or she is going to survive. It's an expectation, not reality. So that is life expectancy at 1. We are taking life expectancy at 1 year, not 0. Okay. And for knowledge, here we were taking schooling years. Here we take literacy rate. Now you tell me what is literacy rate? How to measure the knowledge? This is a country. There are many people in the country. How to measure the knowledge of this country? How to measure the knowledge? We measure knowledge via literacy rate. What is literacy rate? What is literate? Are you literate? Are you literate? Am I literate? What is the definition of literacy? Who is literate? So there is a definition of literacy. Anyone who can read, who can write, and who can understand. Who can understand at least one language. And who is more than 7 years. Because less than 7 years, kids don't do so. I'm having a kid. My kid cannot read, write, and understand. Because he's too little to do so. Because they are learning. So we are excluding the population of 7 years. After 7 years, the one who can read, write, and understand, all 3 things are necessary. If the person can read, cannot write, or read and write, but cannot understand, so it is illiterate. So all three things are necessary. The person can read as well as write as well as understand at least one language. Then it is known as literate. Okay. So here we are taking literacy rate. Here we are taking literacy rate. Got my point? Got my. So see longevity, how we are measuring, knowledge, how we are measuring, and standard of living, how we are measuring. See the range. In HDI, the range is 0 to 1. 0 is worst quality, 1 is best quality. And here range is 0 to 100. 0 is worst, 100 is best. In India, the current HDI is 0.64. It is between 0 to 1. It's above 50%. It is above 0.5. It's 0.64. It's the average quality of life in India. And in India, the PQLI value is 65. So can we revise it together, people? Can we revise it together? So I taught you two measures to measure the quality of life. Now I want to compare the quality of life in two countries. Country A, country B. Maybe India, US, Japan, any two countries you are taking. You want to compare the quality of life of people here and quality of life of people here. Which people have better quality of life among the two? So there should be a criteria. So I'm using two criteria. What are the two criteria? The first criteria is HDI. See the full form? Human Developmental Index. And the second criteria is PQLI, Physical Quality of Life Index. Okay, so there are three components in each of them. You have to see. Okay, so the first thing you have to see the longevity, how to measure longevity in each of them, how to measure the knowledge of a country in each of them, and how to see the standard of living of people in each of them. Okay, so tell me the three. Okay, and tell me the range and tell me the values in India. The values in India. Can you say? So longevity, here we see life expectancy at birth, and here we see life expectancy at 1 year. Okay, knowledge, here we see mean year of schooling plus expected year of schooling upon 2. Here we see literacy rate. And standard of living, here we see income. Okay, that is GDP per capita. Here we don't see income. Instead of I, it's I only, but it's IMR. So third are I, but this I is income, this is IMR. How many of you got it? What is the range? Here the range is 0 to 1. And here the range is 0 to 100. 0 is worst. And 1 and 100 are best respectively. Okay, here the value in India is 0.640 current value, and here it's 65. So almost more or less they are same. Say yes, everyone. You get many questions on that. The HDI and PQLI, these are the indicators of quality of life. Okay, now I'm having two countries in front of me. This is country A, this is country B. Any two country. Okay, India, Japan, any two country, US, any. So you want to compare the quality of life. So you have two choices. Either use HDI or use PQLI. If you are using HDI, if you are using a criteria of HDI to compare the quality of life, you have to see the three things. Life expectancy at birth in both of them. See, the second thing you have to see is the knowledge. By knowledge, I mean mean year of schooling and expected year of schooling in both of them. Okay, and third thing you have to see the income, the GDP per capita in both of them. Okay, now add the three factors here, and see which country is having a better quality of life. Or else the second thing you can do, you can use PQLI. Again, I'm having two countries, country A, country B. Okay, geographical area A, geographical area B. But this time I'm using PQLI. To measure the quality of life. The first thing I will see infant mortality rate. I will not see income. Since I have taken infant is till 1 year of age. So we will not see life expectancy at birth because till 1 year it is covered here. So we will see life expectancy at 1. Okay, and the third component here also we have knowledge, but for knowledge we will see the literacy rate. Okay, so these are the three components here. So see the life expectancy at 1 in both of them, IMR in both of them, and literate. How many people literate here? How many people literate here? Literate means the person who can read, write, and understand at least one language more than 7 years. So now compare the three here, add them, do the summation and compare the results. Okay, now by doing so, you will come to know which country people have better quality of life if we are comparing among them. Say yes if you all got it. Learn the range in both of them, learn the value of India in both of them. You get many questions on that. Now read the question and tell me the answer. Now read the question, now you can answer it. HDI contain all except. So HDI contains all except. HDI is measured from 0 to 1. I told you. It is not from 0 to 100. 0 to 100 is PQLI. That's why this one is wrong. This one is wrong. I hope you all got it. So let's come on the next question. The next topic is, actually we are not discussing the questions. We are discussing the topics. Okay. The next topic is obesity. You usually get question on the BMI. That is basal metabolic index. Okay. So who's the obese person? To whom you can call that the person is obese? there should be a guideline, na? There should be a criteria. So there are various measures or criteria to do the assessment of obesity. What are those? BMI is one of them. BMI, basal metabolic index, is one of them. So do you know the answer? Some people are saying A, some are B, some are C. Can you guess the correct answer? Is it 25, 30, 35 or 40? What is the correct answer? Okay. The correct answer is 30. I will come on the question again. Don't worry. Let me explain you obesity. Let me come on the next topic, obesity. To whom you will call the person is obese. There should be a criteria. Okay. So there are 5 assessments. By 5 factors, parameters, we can assess the obesity. One by one, we will discuss all of them. The most important internationally accepted parameter to assess the obesity is basal metabolic index, that is BMI. What is the full form of BMI? Say the full form. The full form of BMI is basal metabolic index, also known as Quitlet index. One and the same thing. Learn the other name also. Quitlet index pe bhi question aata hai. So please learn that. Okay, this is the internationally, not nationally only, internationally accepted parameter for measuring obesity. So you can calculate your BMI also right now. Do you know your weight in kg? Huh? Not in pounds. Do you know your weight in kg? Do you know your height? Not in feet, in meters. In meters. If you do so, if you know it, calculate it right now. The formula is weight upon height square. Weight upon height square. You can calculate it right now. Okay. So write your weight in kg and height in meters and do the square of the height. So weight upon height square. You can calculate your BMI. Okay. So this is how we calculate BMI. Okay. What is the normal BMI? You can calculate in which range you are coming. Okay. You can calculate yours or any of your family members, any of your known person. If you know the weight and height, weight should be in kg and height should be in meters. Weight upon height ka square. So the normal values of BMI is 18.5 to 25. Read it as 25. You will get confused otherwise. 18.5 to 25. If your value is coming anywhere between that, it can be 19, 20, 21, 22, 23. You are not obese. The person is normal, neither underweight nor overweight. The person is normal weight. Okay, you cannot call that person as obese, neither under. Now, less than 18.5 is underweight. Underweight. That person is underweight. And more than 25 is overweight. So we have 2 more categories. Normal. First learn normal. Then you will understand what is underweight, what is overweight. What is normal? Normal is 18.5 to 25. Less than 18.5 is underweight. And more than 25 is overweight. So calculate yours. Calculate yours in which category you are coming. Underweight is further divided into 3 categories. Grade 1, grade 2, grade 3. 17 to less than 16 is grade 3. 16 to 17 is grade 2. And 17 to 18.5 is grade 3. More than 18.5 is normal. And overweight is more than 25. We have divided it into 4 categories. Underweight is 3 categories, but overweight is 4 categories. Pre-obese, obesity 1, obesity 2, obesity 3. Obesity 3 is morbid obesity. Okay. So pre-obesity is 25 to 30, 5 ka range hai. 25 to 30, 30 to 35, 35 to 40, more than 40. So you get many questions on that. Okay, let me discuss. I am telling you obesity. The best indicator to measure, to assess obesity is basal metabolic index, also known as Quitlet index. What is the formula? The formula is weight in kg upon height square. Height should be in meters. Okay, now what is the normal range? Can you tell me? Tell me the normal range. What is normal? If you know the normal, you can tell me what is underweight and what is overweight. What is overweight? What is underweight and overweight? What is normal? Normal is 18.5 to 25. This is normal. Okay, less than 18.5 is underweight. And obviously, more than 25 is overweight. More than 25. Now, let's divide underweight and overweight further. Let's further divide. Underweight is divided into 3 categories. Grade 1, grade 2 and grade 3. Okay. And overweight is divided in 4 categories. We have pre-obese, obesity 1, obesity 2 and obesity 3. Okay. If you want to learn underweight, it's good. But usually the question is on overweight. So let's say the overweight. It's more than 25. They all are more than 25. So let's take 5 ka range. 25 to 30, 30 to 35, 35 to 40. Okay. And more than 40. So what is your question right now? Your question is obesity start at. Obesity start at. So when you use the word obese, now again the question is tricky. Even if you know it, you can be wrong. Because the question is tricky. What is your question? Question is obesity start at. What's your answer? Don't say 25. No. At 25, there is pre-obese. Obesity, first time it is coming at 30. So my answer is 30, not 25. How many of you got it? At 25, if I say pre-obesity started, so my answer is 25. But obesity is starting at 30. It is not 25. How many of you got it? How many of you got it? So obesity is starting at 30. Okay, so you get many questions on that. So obesity, BMI mein obesity start at 30. Current answer is 30. Say yes. If I change the word obesity to pre-obese, okay, pre-obese, what is the answer right now? Pre-obese start at 25. If I say the word morbid obesity is grade 3. It will be 40. It will be more than 40. In this way, you can get the various question. This is one of the parameter. This is one of the parameter, the best parameter. Apart from that, we have 4 more parameters. Let's discuss them also. Okay? Because you can get question on them also. So there is one more parameter which is known as Broca's index. According to Broca's index, whatever is your height, what is your height in centimeters? Just suppose my height is 155. Okay? In centimeters, my height is 155. So height minus 100. So my ideal weight should be 55. If I'm more than 55 kg, I'm overweight. If I'm less than 55, I'm underweight. So this is a simple version. Okay, height minus 100. Broca's index says height in centimeters minus 100. What is your height? Minus 100. Subtract 100 from that. That should be your ideal weight. That should be your ideal weight. Now you can be less, you can be more. If you are less, you are underweight. If you are more, you are overweight. So this is the Broca's index. The third is important. It is known as Lawrence index. है ना, Lawrence. Now read it, don't learn it. Just read it once. It is height minus 100 minus height minus 150 upon either 2 or 4. If the person is female, use denominator as 2. If the person is male, denominator 4. Don't learn it. But see, in the entire formula, there is no weight. If I'm giving height of a person, for example, the height of person is 172. Can you tell me the person is obese or not obese? I'm telling you height. You will say, ma'am, tell me the weight. Based on the height, how can I tell the person is obese or not obese? You can tell based on Lawrence formula. So Lawrence formula पे एक ही क्वेश्चन आता है. Lawrence formula is height weight independent formula. It's weight independent. Even without weight, you can tell whether the person is obese or not based on the height. Based on the height. And the last one is corpulence index. Actual weight upon desirable weight. The ratio of the two should be less than 1.2. My desirable weight is 55. My actual weight is also 55. So the ratio will be 1. So 1 से 1.2 तक normal है. But 1.2 से more, it will be the person is said to be obese. Got my point? Got my point? So these are the 4. The 5th one, the last one, is skin thickness. Measure the thickness of the skin. Skin. Measure the thickness. There is an instrument. How to measure? There is an instrument. Can you see the instrument? The name of this instrument is Herpenden skin caliper. You can get an image-based question on that. They can ask you what is the procedure. They are measuring the skin. And what is the name of the instrument? The name of the instrument is Herpenden skin caliper. So you have to measure it at 4 locations. At the bicep, okay, at the mid tricep, at the subscapular region, and suprailiac region at the 4, and you have to take the average. In boys, the cutoff is 18, and in girls, the cutoff is 32, because girls have thick skin. Why thick skin? Because the girls have more fat. Subcutaneous tissue is more in the girls, in the females, I mean, it's physiological. So any boy whose skin thickness is more than 18 millimeter, the boy is obese. And any girl whose skin thickness is more than 32 millimeter, the girl is obese. So the cutoff for the boys and girls is different. Say yes. Say yes. Okay. Yes, absolutely right, Descendant. What you are asking? Yes. Here in this formula, height is not included. So it is height independent, and in Lawrence formula, weight is not included. So you get MCQs here, which is height independent, which is weight independent. And Broca's and Quetelet contain both height and weight. So I taught you 5 measures of obesity. What are the 5 measures of obesity? The best is only one. If you can learn all 5, it's good. If you can't learn all 5, learn one. BMI. Learn the best one, internationally accepted. Okay, BMI, also known as Quetelet index. Okay, you know the formula. Okay, the second one is the Broca's. The third one is the Lawrence. The fourth one is the corpuscle. And the last one is the skin thickness. Okay, I have taught you the formula of all of them. The best among them is BMI. The formula is weight upon height square. The weight upon height square. And I told you the complete table also. What is normal? What is underweight? What is overweight? If you know normal, telling underweight and overweight will be very easy for you. The normal range is 18.5 to 25. Never, ever forget it. Say you as yes if you all got it. Okay. Okay, got it. Can we go ahead? Thank you so much for your compliments. Thank you. Okay, at the end of the session, you will feel super confident in PSM. That's my challenge. That's my word. Okay, take it. Anyways, without wasting even a single second, coming on the next question. The next question is in front of you. In triage, black color is used for. You get many questions frequently on the triage. What is a triage? What do you mean by triage? When we do triage, we do triage during disaster. I will come on the question again, don't worry. Okay, we do triage during disaster. Okay, what is a disaster? First, defining disaster. It is an event in which more than 30 people are injured or died together simultaneously. The cutoff is 30 people. More than 30 people are either getting injured or many of them are dead. Casualties are taking place. More than 30 people simultaneously. It is a disaster. It can be a rail track accident. It can be a volcano. It can be an earthquake. It can be anything. Okay. It can be a collapse of a building. It can be anything. It is a disaster. It is known as disaster. Now, during disaster, for example, I'm working in a hospital. Hello. And at 2 a.m. in the night, I got a call from my CMO that rushed to the hospital because there is a disaster took place nearby the hospital and we are expecting many patients to be coming in the next few minutes in our hospital. So all the doctors on emergency duty and I'm one of them. So we are having a limited doctors in our hospital, limited OTs, limited medicines, limited surgical instruments. We have limited everything. But the patients are flooded in the hospital because it is an emergency situation. It is a disaster. It is the only nearby hospital. So all the patients are shifted to the nearby hospital. So it is a panic situation. Hana, being a doctor, if we are not prepared for that, we will be panic. Okay, so what to do, what to deal, to take which patient where. So it's better to get prepared before the emergency arises. So that's why during disaster, so there is a protocol to be followed, which is known as disaster management cycle. So whenever there is an impact, the disaster is happening, the 5 things are to be done in a sequence. The first thing is the rescue and give the first aid on the spot. On the spot, do the rescue, as many as lives you can save. So rescue is given by the uninjured survivors. Okay, then field care. In the field care, we will arrange the camps, we will arrange the ambulance and doctors on the spot. The third thing to be done is triage, which is our question right now. What do you mean by triage? As I told you, all these patients are to be shifted in the hospital, the nearby hospital. Patients are many, but the hospitals may manpower, doctors, nurses, staff, medicines, everything is limited. Okay, so we have to use them very wisely. So we have to divide the patients before they are coming to the hospital into 4 categories. So dividing them, to who will receive the treatment first, the second, the third, and the last. We will divide them in 4 categories. Who is getting the urgent treatment, who require the urgent treatment. So we will use our resources very wisely. So that is known as triage. So what is the basis of the triage? Basis of the triage is not first come, first serve. We are shifting them via ambulance or vehicles to the hospital. So it is not the one who is coming first to the hospital will be served first. No. It is not first come, first serve service. No, it is not that. It is based on the severity of the injury. The person who is more injured given the priority, and the person who is less injured given less priority. So there are 4 color codings we are using. The 4 color codings are red, in the signal, in the traffic signal, what lights we have? Red, yellow, and green. Red, yellow, green, and the last one is black. So we are having 4 colors here. Red, yellow, green, and black. So red is given to the patient which requires immediate attention of the doctors. And immediate surgery within the next 6 hours, if the surgery is done, that we can save the patient. Otherwise, we will lose the patient. So it is a high priority. We will take them to the ICU directly. We will take them to the OTs directly and operate them. So that is the highest priority given red color. The yellow is the second highest priority. We can postpone the surgeries till next 24 hours, but they require attention. Even within 24 hours, if we attend them, it's okay. We can save them. So that is the second priority. The third is the green one, low priority. They have many minor injury. They just require dressing and all. So it is the ambulatory patient. We just discharge them and, it's the minor priority. And black are the dead one. Dead. We have to shift them to the mortuary directly. Dead or moribund. We cannot save them. Even they are so much injured that even after doing the surgeries and attending them, we cannot save them. We put them in the black, or they are the dead patients. Okay? So these are the 4 color codings we are using. Okay, and the basis here is the severity of the injury. The more severe injured, given the highest priority. The less severe injured, given the low priority. It is not first come, first serve service. Okay, so we use tags or we use the wristbands. So in the corridor, so this is the hospital. Okay, so all the patients are shifted in the hospital. So in the corridor only, someone will do the triage, or some doctor or healthcare provider will go to the field. On the field itself, he will do the triage, and based on the triage, only the patients will be shifted. So, when the triage is done in the hospital corridor here or at the field in itself, so in the wrist of every patient, we will put a band, red, or yellow or green or black. So looking at the color, we know where to shift that patient. Once the patient is inside the hospital, the red will go to the OT, the yellow will go in the ICUs or in the wards, the green we can discharge them, the black will go to the mortuary. So we know where to take which patient. Okay, so this is known as triage. Now there is a thing which is known as reverse triage. There is a thing which is known as reverse triage. You got my point? Reverse triage. What is reverse triage? In which we do not follow this rule. What is the rule? What is the rule of the triage? Say, ma'am, more severe injured people are attended first. More severe injured people are given treatment first. Less severe injured given later on. This is the rule. We are breaking the rule. Here in reverse triage, we will give less severe injured people, we will give the attention. We will treat them first. You will say, ma'am, when to do so? You are saying that when the people are injured more, the one who is more injured, first give treatment to that. Hana, follow the sequence. But here you are saying you just break the rule. So we break the rule in an exception. The exception is the soldiers. Hana, the exception is the soldiers. There is a war going on. Imagine a war is going on and the soldiers are injured. Hana. So here we have to follow the reverse triage. Even if the soldiers are less injured as compared to other people, we have to attend them first so that they become fit again and they go to the war again. Hana. So this is the situation where we follow reverse triage. It's also a question. So please learn that. Can we go ahead? How you are finding the session? Give the feedback. Is it good? Is it good? Can we go ahead? Huh? The same strategy. So we are not discussing questions. We are discussing topics. You find it useful to discuss complete topics rather than discussing few questions only? Yes or no? Is it good? Huh? So let's move ahead. Before going to the next question, let me give you a small piece of advice, especially for the FMG aspirants. So here in the last few days of your preparation, the only advice you have to follow is strive for progress, not for perfection. You are having 19 subjects to deal with. 19. Okay, don't even skip one subject. If you got stuck in some subject, in some topic, for example, there is a subject you are finding that subject very difficult. And there is a topic you got stuck there. Leave that topic, move ahead, move. You do not want perfection right now because time is less. You want progress. If you're stuck in some topic, so most of the students, what they do, they watch the same topic on multiple apps from different educator. They see it on YouTube also. Friend के पास दूसरा app है, उसमें भी देख लिया. ओ किसी और educator ने पढ़ाया, उसमें भी देख लिया. So don't waste your time by doing so. Don't. If you are not getting any topic, leave it. Just do the PYQs of that and move further. Progress is important. You have to cover all 19. Leaving a subject is a foolish thing. Don't do so. Can we go ahead? So coming to the next question. Okay, the next question is in front of you. Is the speed good? I'm a little bit on the higher side because I'm assuming that you already revised it once. And now we are just doing the PYQs. So I want to cover maximum PYQs. Okay. So can we go ahead? The next question is in front of you. Okay. So age pyramid of India. The next question is based on the age pyramid. Age pyramid of India. So what is the shape of age pyramid of India? Is it broad at base and narrow at apex? Or is it broad from base to apex? Or is it broad at the apex and narrow at the base? Or is it spindle shaped? What is the correct answer? Yes, the correct answer is the A. It's triangular in shape. It's like this. It's broad at the base and narrow at the apex. It's conical. Either say conical or triangle. So you get questions on the age pyramid. So what is population pyramid or age sex pyramid? What do you mean by that? It's a double histogram. So we make two graphs back to back. We make two graphs back to back. One for the males, one for the females. Here also we have X and Y axis. Here also we have X and Y axis. So it's a double histogram. In which we are taking two histogram and binding them together. One for male, one for female. Now what we are taking on the X axis and what we are taking on the Y axis. On the X axis, we are taking the percentage. We are taking the percentage of population of that particular age group. On the y-axis, we are taking the age groups. Here we take 0 to 5 years, 5 to 10 years, 10 to 20, 10 to 15, 15 to 20, likewise. We will go till 75 to 80 or 80 to 85. What is the maximum life expectancy of that country? Now, in 0 to 5 age group, how many males are there and how many females are there? In 5 to 10, how many males are there? How many females are there? Likewise, we will make it. So it looks like this. Can you see? Can you see the colors here? Say yes if you see. So it looks like this. You can see this is the percentage here. You can see this is the males. This is the females. Or else this can be female, this can be male. Okay. So on one side we have male on one side. So this is like this. So based on this, we have two type of age sex pyramid. Population pyramid. There are two types. What are the two types? This one, broad at the base and narrow at the apex. This is known as conical. This one is conical or triangular. And the second one, there is a bulge at the center. Narrow upwards, narrow downwards. There is a bulge at the center. This is known as dumbbell shape. Dumbbell shape or bulge at the center. This shape is known as dumbbell shape. Okay. Now in developing country like India, it's like this. And in developed country, it's like this. In developed country, maximum population is young population. Maximum. And the extremes are less. Children are less. Old people are less. But maximum bulge is the young. Here in India, the maximum are the, children. And the young people are less and old are very less. So this is developing country. This is developed. This is like India and this is like US. So based on that, we can decide the fertility pattern. So this is age sex pyramid. How many of you got it? How many of you got it? Got it. So these are the two shapes. Based on the age sex pyramid, we get three information. What are the three information we get here? See the shape, see the height, see the symmetry. See three things here. See their shape, see their maximum height, see their symmetry. Shape tells us fertility. Height tells us life expectancy and symmetry tells us sex ratio. Let me explain. So see the shape. What is the shape here? Here you can see it's triangular shape. And here you can see this one is dumbbell shape. Okay, what do you mean by that? I told you, fertility. So here maximum children are there. Fertility is more. And here maximum young people are there. But children and old people are less. So here fertility is less. So here fertility is more, fertility is less. This is developing country, this is developed country. So based on that, we can decide. Okay, this is our question right now. The first, shape. The second, see the maximum height. You can see here maximum height is still 80 years. And here it is still 90 years, a little bit taller. Here it is tall, but it is more taller. So here maximum people surviving till 80. Here maximum people surviving till 90. So more the tall, more is the life expectancy. This is in this country, maximum people surviving till here. It's 80 years. And here till 90, maybe 100 years. Okay, got my point. So here tallness. More is the tall, more is the life expectancy. And less shorter one have less life expectancy. So height indicate life expectancy. And see the symmetry. Symmetry means if you fold it from the center, whether they are overlapping or not overlapping. So this side we have male, this side we have female. It should be symmetrical, exactly symmetrical. So that one male, one female, 1:1, sex ratio is 1. So the symmetry is indicating the sex ratio. Here you can see it's not symmetrical. You can see the males are more this side and females are less. It's not symmetrical. Okay, so it is giving an indicator of the sex ratio. So in a population pyramid, you get three questions. What is the shape? What is the height? What is the shape indicating us? What is the height indicating us? And what is the symmetry indicating us? Tell me the answers. Shape, there are two types of shape. I told you, triangular or conical and dumbbell shape. So shape is indicating us the fertility pattern of that country based on which developing and developed country. Height indicates us life expectancy and symmetry indicates us sex ratio. You get questions on that. How many of you got it? Kindly confirm now. Keep interacting. You can see me, you can see my gesture, but I cannot see you. Whatever I can see is the chat box only. So keep interacting. Say yes. Give an indication that you got it. And if you didn't got it, you are free to ask. Don't hesitate. Ask your doubt without any hesitation. So, but your doubt should be specific. Okay, what is your doubt? Okay, can we go ahead? Everyone? Okay. So coming on the next question. The next question is dependency ratio. Few questions from the demography we are looking at. Okay, what is the numerator of the dependency ratio? What is the dependency ratio? If you know what is dependency ratio, you can tell me what is the numerator here. What is the numerator of dependency ratio? You can tell me that. What's the numerator of dependency ratio? Yes, what is the correct answer? Yes, the correct answer is B. So in a population, we divide the population into three categories. Less than 15-year people cannot work. They are children, they cannot work. They are not allowed to work legally also. If any child who is less than 15 years and doing any job, it's a crime. Okay. And more than 65 years of age also, people cannot work. They get retirement. So more than 65, they are old. So they are dependent people. On whom they are dependent? They are dependent on 15 to 65. So this is the working population. So basically, dependency ratio is the ratio of non-earning upon earning. It's the ratio of non-earning population upon earning population. Simple, very simple. Who's non-earning? Add the two. Less than 15 plus more than 65. Add the two. And who is earning? Earning is 15 to 65. So this ratio, it's a ratio because numerator is not a part of denominator. You can say numerator is different, denominator is different. So it's not a rate, it's not a proportion, it's a ratio. You know, in rate and proportion, the numerator is a part of denominator. Here, numerator and denominator are not related to each other. That's why I call it a ratio. I don't call it a rate. I don't call it a proportion. So that is dependency ratio. How many of you got it? So what is dependency ratio? Dependency ratio of the it is a ratio of the dependent population. Whose dependent population? Less than 15 years and more than 65 years. They are dependent on the working population. So it is the ratio of non-earning to earning, simply. Or it is the ratio of dependent upon productive population. This is dependent population upon productive population. So the formula is in front of you. It's less than 15 plus more than 65. You have to add them. Summation. Add upon 15 to 65. How many of you got it? How many of you got it? The next question is in front of you. Be fast. Birth rate reduced and death rate also reduced. In which stage it happens? In which stage of population cycle it happens? You know, the complete population, the stages of a population cycle, population curve. So in which stage it happened? Stage 1, stage 2, stage 3, stage 4. I'm saying birth rate is reduced and death rate is also reduced. Both are reducing. So in which stage it happens? Yes, it happens in stage 4. Let me tell you, demographic cycle. Okay. So what is demographic cycle? Many students may not be aware ki bhai ye hota kya hai. What do you mean by demographic cycle? So any country, the population of any country passes through the different stages of the cycle one by one. Currently, India is in stage 3. Let me explain you all 5. Currently, India is in stage 3. Before 1920, India was in stage 1. 1920 to 1930, India was in stage 2. And 1930 onwards, till 2023 also. 1930 till 2023 also. India is in stage 3. We are eagerly waiting to move on the stage 4, but it will take many years ahead. Okay. We should immediately move on stage 4. And finally, stage 5, we do not want to enter in that. So best stage is stage 4. Let me explain the meaning. You yourself will get it right. Okay. Listen. So please understand what is demographic cycle. Can you see this diagram? Everyone on the screen. Can you see this diagram? Everyone see here. So you can see the complete line and you can see a dotted line. The complete line is the birth rate and the dotted is the death rate. When the birth rate and death rate both are equal, they will cancel each out. Birth rate and death rate, they will cancel each out. You are getting my point? दोनों आपस में cancel हो जाएंगे. If they cancel each other, the population growth will be 0. The population growth will be 0. You'll say, ma'am, this is the best thing. The population will become stable. But this stage is stage 1. But the problem is that both are very high. Birth rate is also very high. Death rate is also very high. And they are cancelling each other. Okay. Birth rate high is not a good thing. What do you mean by birth rate high? There is a country in which the birth rate is very high. What do you mean by that? The people are reproducing more and more and more. One day the system will collapse. Okay. Death rate is very high. What do you mean by that? People are dying more in a country. It means the health facilities are not good. Good doctors are not available. Good hospitals are not available. Good healthcare facilities are not available. Good scientists are not there. Good medicines are. That's why people are dying more. So both these things we do not want. We want birth rate to be less. People should less reproduce. Currently, the norm we promote is hum do hamare do. So each couple should have maximum 2 children. Okay, so that is what we are promoting right now. So birth rate should be low and death rate should also be low. Now, to reduce the birth rate, the person should use the contraception. The couple should use contraception during sexual intercourse. And to reduce the death rate, the healthcare facilities of that country should improve day by day. Healthcare facilities, the doctors should be good, everything should be good. Okay, hospital should. So healthcare facilities ko improve karna to reduce the death rate. How many of you are getting it? We want to reduce the birth rate also, death rate also. We want to reduce both. Currently, the birth rate is very high and death rate is very high, although they are equal and they are cancelling each out. So population is stable. This stage is known as high stationary. What is the stage known as? The word itself depicts its meaning. It's stationary. The population is stationary. It's not growing. But birth rate and death rate both are high. That's why it is known as high stationary. Okay. So India was in this phase before 1920. Before 1920, India was in this phase. After 1920, we move in this phase and we remain there in stage 2 for 10 years, 1920 to 1930. India remained. What do you mean? So लोगों को समझ में आई कि death rate should fall. So here the death rate started falling. Good doctors were there, good hospitals. We improved the doctors, we improved the hospitals, we improved the healthcare facilities, we improved PHC, CHC. So death rate started falling. But still people are reproducing in India. So birth rate is still same. You can see. So birth rate is still same, but death rate started falling. So it is known as stage 2. So it is better than stage 1 at least. So the name of this stage is early expanding. It's early expanding. Population is expanding here, na? Here the population was stable. Here it is expanding now. Okay, expanding now. Now people got it that we have to reduce the birth rate also. So death rate still further fall. It fall further. है ना? More fall. Because more healthcare facilities are good, more doctors are good. But birth rate also started falling. So first time birth rate started falling in stage 3. So India entered in this stage in 1930 till date. Till date only we are in this stage only. So since many long years we are in this stage. And this stage is known as late expanding. इस पे बहुत question आता है. This is known as late expanding. The best is what we all want. We want birth rate and death rate to be equal so that they cancel each out. Currently, India is a very populous country. If we follow the same trend now, people do not understand. They don't use contraception during sexual intercourse. They reproduce like anything. So the complete system will collapse. Hana, we don't have much resources. We have manpower only, but we don't have much resources. We are talking about India. So we have to reduce the birth rate also, death rate also, so that they cancel each out, they become equal. So this stage is known as low stationary. Population will become stationary. It will be a stable model. It will be a stable model, the best model. And birth rate, death rate, both are less. What are the current values of birth rate and death rate in India? The current birth rate is 21 and death rate is 6. Hana, you can see the difference. I want to make it equal. Okay, 21 minus 6. How much is it? 21 minus 6, it is nearly 15. 15, yes. Hana. So it's nearly 15. You got it? It's nearly 15. So there is a difference. Okay, we want to make it equal so that they cancel each out. So we can make it equal. We can reduce the birth rate. We cannot reduce the death rate further. Reducing death rate further is very difficult. We are already at the extreme. But reducing birth rate is still possible. Got it? That is stage 4. How many of you are getting it? And finally the stage 5. So the stage 4 is known as low stationary. There is a stage which is stage 5 in which it can happen that birth rate is less than the death rate. People are dying more and taking birth less. So there are few exceptional countries like Germany is the only country. We can say the example here. Germany and Hungary are the countries which are coming in stage 5. It is known as declining. These countries are shrinking and one day they will collapse. They will, completely extinct from the globe because they are collapsing. They are extincting. Their population is shrinking. Here the people are dying more and taking birth less. So this is known as declining phase. So tell me the 5 phases. What are the 5 phases, people, in a demographic cycle? Say, ma'am, stage 1, stage 2, stage 3, stage 4, and stage 5. Okay, now you have to tell me 3 things. Number 1, tell me the names of these phases. Tell me the birth rate in each of them. Tell me the death rate in each of them and examples in each of them. Who will tell me? What are the 5 stages in demographic cycle? We are studying demographic cycle. People, we are studying demographic cycle. The first is high stationary. High stationary. And the 4th one is low stationary. Low stationary. In both of them, the population is constant. Okay. Here it is early expanding. Stage 2, early expanding. This one is late expanding. And 5th is always declining. The population is declining. Okay, tell me the birth rate and death rate. Your birth rate is very high, death rate is very high, and they cancel each out. They are equal, cancel each out. Here, the birth rate is still high, but death rate started just falling. So population is expanding. Here, birth rate also start falling, and here it fall further. The death rate fall further. So it is late expanding. Here, birth rate and death rate both are low, and they cancel each out. And declining may birth rate is less, death rate is more. Ulta ho gaya, reverse, hai na? So that is declining. Say yes, hai na? We have to see the examples of all 5. So the same thing. So you have this, I have drawn it for you. The 5 phases, 1, 2, 3, 4, 5. Okay, see the birth rate, see the death rate. Okay, so that is the thing. Can we go ahead now? The next question is in front of you. So I told you the examples now. Stage 1, 2, 3, 4, 5. Stage 1, India was here before 1920. 1920 to 1930. 1930 is known as year of big dividend. Is pe bhi question aata hai. So that is stage 2. 1930 onwards till date, India is in this stage. Stage 4, that is the best one. Only one country have touched it. The name of that country is Austria, not Australia. It is Austria. Other countries like US, UK, and Denmark, they are about to touch, but not yet. So Austria is the only country. And here we have Germany and Hungary. Okay, say yes if you all got it. Say yes. Can we go ahead? The next question is in front of you. Okay, please read the question and tell me the answer. Anyone among the audience? Give me a minute. What is the question? What is the mechanism of action of OCP? So it's trying to study complete contraceptive. So the next topic is contraception. I will teach you all about the contraception. Definitely, you are going to get one question on the contraception. Okay, every year you get it. Okay, G, say yes. So what is the correct answer here? First you guess, then we will come on the question again. So how does OCP pills work? The oral contraceptive pills work. So what is the correct answer? Yes. So they prevent the release of the ovum from the ovary. No ovum, no fertilization, and no zygote formation, no conceive, no pregnancy. Okay. So I will tell you everything about the contraception. Not only OCP, we will study everything. We will come on this also, including OCP, but I will tell you. You want me to tell all contraception or you want me to tell only OCP? Because it is not necessary you're going to get question on OCP. You can get question on any of them. But definitely, mark my words, in your FMG exam, you will get one question on contraceptive. Every year you get it. But the question differ. So we will do it quickly, but okay, I will take it all, but I will do it quickly. Okay, chalo, listen. So there are two methods of contraception, spacing method and termination method. Now there is a couple in which there is a husband and there is a wife. Okay, they have already one children. They already have one children, but they want to reproduce more in future, but not currently. Maybe after 2 years, 3 years, they want to reproduce. So we will provide them spacing methods. Okay, so that after their fertility is not terminated, their fertility is only suppressed, and whenever they want to reproduce, they can reproduce. But in termination method, we will permanently terminate the fertility. So in the male vasectomy is done, in the female tubectomy is done. In one couple, only one surgery is required. In one couple, vasectomy, tubectomy, both are not required. If the couple is loyal, husband and wife, so either the husband vasectomy or the wife tubectomy is done. Okay, so that is the terminal. They already have 2 children, they do not want to expand their family, so we offer them terminal methods. Okay, so we will discuss the spacing methods here. Spacing, there are 4 methods of the spacing. I will discuss all 4 in detail one by one. Natural methods, there are 7 natural methods. I will discuss all 7 one by one. The barrier methods, there are 4 barrier methods: the male condom, the female condom, the diaphragm, and the vaginal sponge. Okay, the male condom is only used by male condom, of course by males, and the remaining 3 are used by the female condom, the diaphragm, and the vaginal sponge. We will see. The third is IUCD, and the fourth is OCP. Our question is on OCP. So one by one we will see one. Okay, the first, let's start natural methods. I told you there are 7. These are the 7 natural methods. You get frequently questions on them. So what are the 7 natural methods? The first one is the safe period. We will see one by one. The first is the safe period rhythm method or calendar method. What do you mean by safe period rhythm method or calendar method? So here programmed sex is done. So sexual intercourse is done. It is programmed depending on the menstrual cycle of the female, of the wife, the menstrual cycle. Now in females, the ideal menstrual cycle is 28 days. So every 28 days it is repeated, but hardly few females have the regular menstrual cycle. Many females have, it is not every 28 days. It may be range. There is a range. So maybe 22 to 35 days. Some females will say, like, some will say I'm having 26 to 30 days. So there is a range. As low as this, as high as this. So there is the smallest cycle, there is the largest cycle. So you have to ask the question, you have many menstrual cycles till date. You have to ask the question to the wife. You have many menstrual cycles till date. Just suppose I'm a gynecologist, I'm an obstetrician, and there is a couple in front of me taking the counseling for the contraception. So I will ask the couple, I will ask the lady, I will ask the wife that you have many menstrual cycles. What is your smallest cycle till date? And what is the largest cycle till date? So she will answer maybe the smallest, as small as 20 days, 22 days, as large as 30 days, 35 days, 40 days, whatever. So there is a smallest cycle, there is a largest cycle. There are few ladies, they said, though I have a regular cycle every 28 days. So smallest and largest, both I will consider 28. So the formula is the fertile period in which the sexual intercourse has to be avoided is shortest cycle minus 18 and longest cycle minus 10. Shortest minus 18 to longest minus 10. So this period, for example, the shortest and longest both are 28. Both are 28. The lady is having regular menstruation every 28 days. So 28 minus 18 to 28 minus 10. I'm considering both same. So here it is 10 to 18 days. So in the entire month, 10 to 18 days, the sexual intercourse has to be avoided because it is fertile period. Before that or after that, it can be done. Okay, so this is the red zone. So in the calendar, we will mark the red zone that during which the sexual intercourse has to be avoided. This is calendar method. So what is the formula? Shortest minus 18 to longest minus 10. Just learn the formula. And this period is fertile period during which the sexual intercourse has to be avoided if the couple want the contraception. If the couple want to conceive, during this period, the sexual intercourse is promoted. So this is programmed sex. But the drawbacks are there in irregular cycles, educated couples are required, it's programmed sex, and also drawbacks are there. The second natural method is basal body temperature, BBT, basal body temperature. So here the point is that, in a 28-day cycle, this is day 1, this is day 28. In a regular cycle, on day 14, the ovulation take place. है ना. Before that there is estrogen, and once the Graafian follicle get ruptured, the ova is released, there is progesterone. Progesterone increases temperature. The formula is that, the funda is that, the concept is that progesterone increases temperature. So ask the lady to take the temperature daily, 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 daily. Hardly there will be 0.2 to 0.3 degree rise on this day. As soon as the 0.2, no, she can notice 0.2, she will not have high grade fever that I'm having 101 fever. No, it will be hardly 0.2 to 0.3 degree centigrade, itna rise. So she can notice that only if she's measuring it regularly. So she come to know that yes, today a little bit higher temperature is there. She is not having fever. She is not feeling sick. But due to the rupture of the Graafian follicle, the progesterone is there, and progesterone is causing this temperature surge. Okay, and she came to know that she is ovulating, and during the next few days, 2-3 days, the sexual intercourse has to be avoided. Okay, so this is basal body temperature. So daily the temperature has to be taken. Okay, and progesterone is doing the high temperature during ovulation. Okay, it is due to progesterone. So this is the funda, the second thing. The third method, the natural method of the contraception, is cervical mucus method. Okay, billing method is also, it is known as billing method. Again, it is done by the wife. Again, it is done by the female partner. Okay, the female partner, the funda is that, again, I told you, in a menstrual cycle, if we consider the regular menstrual cycle, 1 to 28, on day 14, when the ovulation takes place, when the ovulation takes place, at that time, the cervical mucus becomes slippery. It becomes very smooth. Have you seen the egg white? Have you hatched an egg? When you see the hatch of egg, there is a yellow portion, there is a white portion. Have you seen the white portion, the transparent one? Have you tried like doing this to the egg white? You can see a string is formed. A string is formed. It's very sticky, slippery, smooth, sticky. The best example, the consistency is like an egg white. Egg white. It occurs on ovulation. But the lady can come to know only if she is seeing the consistency daily. So again, it requires a high degree of motivation that whenever the wife, the lady, the female partner is using the washroom, at that time daily, she should notice the consistency of the cervical mucus. When the consistency of the cervical mucus is like this, can you see like this? You can see a string is formed. Here no string is formed, here no string, here hardly any string, thick string. Here it is like a egg white. It is known as watery, clear, slippery, profuse. So at that day she is ovulating. It can give a rough idea. Again, these all natural methods have a very high failure rate, but just for the question purpose you should come to know. Okay, again it is done by progesterone. So till now I taught you 3 methods. The first is the safe method, calendar method, depending on the menstrual cycle ka length. The second is the basal body temperature. The basal body temperature rise is due to progesterone, and third, cervical mucus. The cervical mucus, the consistency of the cervical mucus. Say yes if you got it. Combine the 3 together. The calendar, basal body temperature, and cervical mucus, the billing. The combination of the 3 will have less failure rate. If the couple is using this alone, or this alone, the failure rate are high. But let's combine the 3. The day when the temperature is also rising, when the cervical mucus is also like egg white, it's slippery, it's thin, and the day when in the calendar also it's the red zone, it's the fertile zone. Combine the 3, so that day is actual ovulating. So this method is known as sympathothermic method. Give me a thumbs up. Got it? The 4th method. The 5th is the abstinence. Abstinence is complete absence of the sexual intercourse. Okay, that is the 5th method. It's a natural method, so of course it's the method. Coitus interruptus. It is the oldest method where the male partner just withdraws the penis before ejaculation, but here very, very high failure rate is there. And the 6th method is the lactational amenorrhea. What is lactational amenorrhea? Whenever there is a female who is doing breastfeeding to the child. So till she is doing breastfeeding every 2 hours to the child, she will not have the menstruation. She will not ovulate. And it's a natural method. So it is good for the mother also, it's good for the baby also. Breastfeeding is always good for the baby. Baby is getting nutritional food from the mother. It is good for the mother. She will not become pregnant again. Even she is doing the sexual intercourse with the husband, she will not become pregnant again, because it is good for the mother, because she is already having a little one with her. Now, let the little one grow. 2 or 3 years gap should be there between 2 pregnancies ideally. She has just delivered a baby. She is weak. So let her body again build up, and then she can become pregnant again. So it is good for the mother also. So breastfeeding is good for both, the mother also, the baby also. To the baby, it is giving nutritious food. To the mother, it is giving natural way of contraception. Natural way. So till she is doing exclusive breastfeeding to the baby till 6 months, every 2 or 3 hours, she is breastfeeding her baby, and she is having an ovulation. She don't have ovulate. She don't ovulate. Okay, so this is lactational amenorrhea. Okay, so we are done with the natural methods. How many of you got it? We are done with all 7 natural methods. Yes, prolactin suppression. Absolutely right. Okay, so the natural methods I taught you. Now coming on the barrier methods, have a look. So we are having 4 methods here: male condom, female condom, diaphragm, and vaginal sponge. These 3 are used by the female partner, and this is used by the male partner. If we say condom, by default it's male condom. I know it is the condom is the most widely used barrier method throughout the world. In India also, world also. In India, it is better known by its trade name, that is Nirod. And in male condom, only 1 ring is there. In female condom, there are 2 rings. It's MCQ. So please learn. In male condom, there is only 1 ring. In contrast to the female condom, you can see there are 2 rings. Male condom is not reusable, but female condom can be reusable. Okay. And female condom prevents the pregnancy, of course, but it prevents the STDs also. The male-female condom both prevents STDs also. It is having 2 rings, the female condom, the internal, the external. Okay. So that is the thing. Diaphragm. It is also known as Dutch cap. So diaphragm, it's like this. It has to be worn in the vagina by the female partner before sexual intercourse. It has to be kept in the vagina maximum 6 hours after sexual intercourse. If it is more than 6 hours in the vagina after sexual intercourse, it have a risk. It will cause toxic shock syndrome. So these are all MCQs, which we are just quickly covering. I know you know all, but we are just brushing up the concepts quickly. The next is the vaginal sponge. It's like a sponge. It's like a sponge. It's like a small sponge. It has to be worn by the female partner inside the vagina just before the sexual intercourse. And again, it has to be kept there for 6 hours maximum. Otherwise, it can also cause toxic shock syndrome. You don't have to learn the size, but it's like a sponge-like thing. And it contains nanoxynol 9. What is this nanoxynol 9? It is a spermicidal chemical. Learn this name. It's also a PYQ. It's spermicidal. So it's double acting. It's acting as a barrier also. Now the female have worn it. Now whenever there is sexual intercourse, the sperms are coming. So number 1, there is a barrier. There is a barrier. The sponge is not allowing the sperm to penetrate, to go inside. Number 1. And number 2, if by default, by any mistake, if the sperm is going, the sperm will be dead because it contains the spermicidal jelly. The spermicidal jelly composition is nanoxynol 9. So it contains the chemical also. So physical as well as chemical barrier. So we are done with the natural. We are done with the barrier. But maximum questions come on IUCDs, IUCD and OCP. So let's do them one by one. Let's start IUCD. What is IUCD? Intrauterine contraceptive device. Intrauterine contraceptive device. IUCDs. Okay, IUCDs. So they look like T. Their shape is like this. They are like T. They are copper T. Okay, and they have to be worn. They have to be put inside the uterus. Can you see? They have to be put inside the uterus. The female cannot put it by herself. A trained gynecologist is required to put it, to insert it. I mean, the female herself cannot insert it. Like the diaphragm and this thing, sponge and the condom, she was putting by herself now. But no, the copper T, she requires someone, some gynecologist or doctor to insert it. Okay, so that is made up of copper usually. There are 2 types of copper T. First generation and second, third generation. The first generation are non-medicated and second and third generation are medicated. Are you people there? Listening? Is it too fast? I'm just revising the concept quickly in the contraception. Okay, you frequently get questions on the contraception. That's why the speed is little bit on higher side. Okay. So first generation is non-medicated and second and third generation is medicated. Okay. So there are certain numbers mentioned. For example, copper T 220. What is this 220? Copper T 380. What is this 380? Copper T 7. What is the 7? So what are these numbers which are indicated? Number indicate the surface area of the copper. It's a PYQ. Please learn it. It's a PYQ. What does the number indicate on copper T? The number indicates the surface area of the copper in that particular copper T in millimeters square. So for example, copper T 380 means 380 millimeter square copper is there. Copper T 220 means 220 millimeter square copper is there. So that is the surface area. Please learn it. And there are certain letters. You can see A, B, C, D. Certain letters are written. Copper T A, copper T B, C, D. So it depends on the size of the uterus. Different females have different size of the uterus. The size of uterus is not constant in all the females. Okay. So just suppose I'm a gynecologist and there is a lady and she wants the contraception and she wants contraception for next 2-3 years. So I'm advising her to use the copper T. She already have 1 child. Copper T should not be inserted in nullipara. She already have 1 child. Now for the next child, she wants some gap. Okay. So I'm advising her to insert the copper T. So before inserting the copper T, by doing pelvic examination or by doing a pelvic sonography, I will judge, being a gynecologist, being a doctor, I will judge the size of her uterus. So there are 4 sizes of the uterus, A, B, C, D. You can see D is the largest, A is the smallest. So depending on the size of her uterus, I can take the copper T of that size. If the uterus is very small, I can say A. And if the uterus is very large, that lady is very obese, bulky and large uterus, so I can take the D size also. So the size has to be taken appropriate. Otherwise, if the uterus is small and you by mistake you are inserting a large size copper T, so it can cause the perfo. It can cause the perfo and it can cause the pain also because it will put pressure. So judging the size is very important. Okay, number 2. Number 3, in some of them A or AG is written. AG. You can see copper T 380 AG. AG. AG is the chemical formula for silver. It contains silver in that. Silver, yes, Chandi, silver. It contains silver. Okay, it contains silver in that. So please learn the numbers indicate what? It indicates the surface area of the copper. The letters indicate what? The size. The size. The letter indicates the size. A is the smallest, D is the largest. 4 sizes are available. And AG indicates the silver. Silver or gold. Say yes, these all are your PYQs. Quickly we are covering. Okay, so as I told you, there are 3 generations IUCD. First, second, third. First generation IUCD are non-medicated, they are inert. Second generation IUCD and third generation, they are medicated. Second generation contain copper. And third generation, they contain metallic copper. Okay, metallic ion, that is copper. And third generation contain hormone. So these all are medicated, second and third. Second is medicated because it contains copper. It is a metallic ion. And the third contain the hormones. You have to learn the examples now. Learn the examples. In first generation, we have only 2 examples. Lippes loop and Grafenberg ring. Lippes loop, Grafenberg ring. Both of them we don't use nowadays because we have better options available. So these were the first one which were discovered. Lippes loop. You can see this is Lippes loop. But we don't use it nowadays. We don't use it because better options are available. Okay. So we use the better option, the second or the third. Okay. The third are the best one. In the second, various copper Ts are there. In the third also, we have only 2 examples. One is progesterone and one is LNG. Progesterone and LNG. These 2 are the examples here. You can see progesterone and LNG. And remaining all are second generation. These all are various types of copper Ts with different numbers and different letters. So first generation, third generation and second generation. Learn the example. First generation, second generation, third generation. The types of IUCD. First generation are non-medicated. They are inert, non-medicated. Okay. Second generation contain copper and third generation contain hormone. The first thing you have to understand this. Okay. Learn the example. Here 2 examples. Lippes loop, Grafenberg ring. Here also 2 examples. Progesterone, LNG, and all the copper Ts, various types of copper Ts will come here. Okay. So it's very easy to learn, to understand the process. Now learn the shelf life. Once just suppose there is a lady and we have inserted the copper T inside her. We have already inserted. After how many years it has to be replaced or it has to be taken out? After how many years? What is the shelf life? What is the shelf life? So different copper Ts have different shelf life. Different IUCDs have different shelf life. I mean, maximum copper one, the second generation one, most of them have 3 to 5 years. The second generation, most of them. Learn both third generation. One is progesterone, one is LNG. Progesterone has to be replaced every year. Okay, every year. But LNG in 7 to 10 years. The longest life, 10 years, is silver one. 380 silver. Silver one is costly. It's very costly. Of course, it contains silver in that. That's why it's costly. But it is worth because once put, it will be there for 10 years. After 10 years, the lady can replace it. Say yes. So it is once in 10 years. It's a question. It's a PYQ. If you can learn all, it's good. If you can't learn all, learn copper T380. Copper T380 AG. This is having the longest shelf life, that too 10 years. That too, it contains silver in that. And the shelf life is 10 years. It's a PYQ. So please learn that. What are the side effects of the copper T? Say yes, quickly. What are the side effects? The most common side effect, it's a question, it's bleeding. So once you put the copper T inside the lady, you insert it in the uterus, she will complain of bleeding. She will call you, doctor, I'm having bleeding. Just reassure her. The bleeding will be continued for 2 to 3 months. Maybe without menstruation also, intermenstruation also, she will have bleeding. But after 2 to 3 months, it will be regularized. Okay, only bleeding will be there only during menstruation. But if the bleeding is too much, you have to remove it. The causes of a bleeding may be the uterus is small and you have put a big IUCD. The size is disproportionate. Maybe this is the cause. So you have to first reassure, but if it continues and if it is excessive, then you have to remove it. Second most common side effect is pain. After inserting, the pain is there. But most common side effect which require removal is pain. So the 2 different questions are there. If they ask you most common side effect of IUCD, what is the answer? And if they ask you what is the most common side effect of IUCD which require removal? What is the answer in that case? What is the answer? The 2 questions, the 2 answers. Dono PYQ hai in FMG exam. Say. So most common side effect is bleeding, of course. But most common side effect which require removal is pain. Pain is also second most common side effect. Okay, so please learn it, learn it. Apart from that, PID, pelvic inflammatory disease can be there. Infections can be there if you are not following the aseptic procedure. Hana, while inserting it, the gloves should be, the glove should be aseptic and like that. Okay, uterine perfo is there. Okay, sometime if you insert a big into a small uterus, the perfo can be there. It will be severe painful condition. You can immediately order an X-ray. On the X-ray, you can see this is the uterus, inside which you can see one of the wing of the T is coming out. It is doing a perfo over here. It is coming out. Immediate removal. Immediate, take a call and remove it. Immediate surgery and removal is required. And spontaneous expulsion. In all the copper T's, there is a two threads are provided, which is known as tail. Two threads are provided here. The threads are there coming out of the vagina. They are coming out of the vagina and the vulva. It is just for the checking. So whenever the lady is using the washroom, she can check the threads are there. So copper T is inside the uterus. She can get reassured that yes, the copper T is inside there. So sometime during micturating or defecating, it can happen that spontaneous expulsion can happen and she is not aware that copper T is already expelled out. Sometime it can happen. So we ask the lady to check the tail frequently, regularly, and if any time she comes to know that the tail is missing, she has to come immediately to the doctor. Okay, so this is the spontaneous expulsion sometime can happen. Now you got the side effects. On side effect, you get only two PYQ. Most common side effect which require removal. These two are the PYQs. These two. But these all are PYQs. Now tell me 3 questions. Tell me 6 questions, 6 answers. Tell me a IUCD which is having highest pregnancy rate, which is having lowest pregnancy rate. What do you mean by pregnancy rate? Sometimes the lady is there, the female, the wife is there, in which the copper T is already inserted. Still she become pregnant because nothing is 100% in this world. Not even the Carnot engine. You have read this in physics. Carnot engine even is not 100%. Nothing is 100%. Failure rates are everywhere. So maybe some of the unlucky ones, even on copper T inserted, they become pregnant. They conceive and they become pregnant. So it is known as failure rate. It is known as unwanted pregnancy. They do not want it, but still the pregnancy took place. So it is known as pregnancy rate. So tell me 2 questions. Pregnancy rate highest किस में होता है and lowest किस में होता है? Okay, this is the first 2 questions. The second, expulsion rate, highest and lowest. Spontaneous expulsion. The lady is micturating, using a toilet, and the copper T just came out, while micturating. Okay, it is spontaneous expulsion. So highest kiss mein, lowest kiss mein. And tell me the removal. Removal ka cause that pain, the one who is causing highest pain, highest removal. The one which is causing lowest pain is lowest removal. So I want such a copper T which is having lowest pregnancy rate, lowest expulsion rate, and lowest removal. That is the best one. But unfortunately, it is not one. Different have different properties. So you have to learn that. Okay, got my point? So listen, highest pregnancy rate is in Lippes root. That's why we do not use it. It is first generation. I told you it is out of the stock now. We don't use it nowadays. Okay. Highest expulsion rate is also in Lippes loop. That's why we do not use them. We do not use them. So 2 highest are in Lippes loop only, the first generation. The pregnancy, expulsion. But highest removal is in LNG. Although it's a 3rd generation, it is the best, but it causes pain. It causes pain. It has to be, it causes pain. So highest removal rate is in LNG. Okay. Lowest pregnancy rate is in LNG. But in LNG, one thing is bad, but one thing is good. It is having lowest pregnancy rate. Lowest expulsion rate is in progesterone and lowest removal rate is in progesterone. So overall, if you see, progesterone is the best. The 3rd generation progesterone is the best one to be used if the person can afford. How many of you got it? These are the 6 questions in front of you. So tell me pregnancy rate, highest and lowest. Tell me expulsion rate, highest and lowest. And tell me removal, the one which require removal due to pain, highest and lowest. So 6 questions, 6 answer. So highest pregnancy rate, Griffey's loop, Lippes loop. Okay, Lippes loop. And highest expulsion rate is also Lippes loop. Okay, that's why we do not use it. Okay, but highest removal is required in LNG, the 3rd generation LNG. Although it requires highest removal, but the best part is that it is having lowest pregnancy rate. Pregnancy rate failure के chances बहुत कम है LNG में. And lowest removal is progesterone and lowest expulsion is also progesterone. Say yes, everyone. I tried my best to explain you. These all are your PYQs. You have to learn it. There is no choice. You have to learn it. Can we go ahead? Okay. So go ahead. What is the best timing of insertion? Now there is a lady coming to me, है ना? There is a female coming to me and she's saying, doctor, I want IUCD insertion. Okay. So shall I insert it right now without asking anything? Yes, just lie down. I will just do a pelvic examination, see what is the size available and what is the size applicable for you, and I will just insert it. No, I cannot do so. I will ask, what is the day of menstrual cycle is it you are today? Which day in which you are today menstrual cycle का कौन सा दिन है? Which day you are in? So usually menstrual cycle like 0 to 28 days. So we want to insert it during menstruation, at the time of menstruation, or maximum up to 10 days. है ना? The menstrual bleeding happens for 3 to 4 days. After 3 to 4 days, 5 days, bleeding is not there. So up to 10 days we can insert. After 10 days we cannot insert. If the lady is coming in this period, ask the lady to come in the next cycle. Next cycle during menstruation, when she is bleeding, that is the best time to insert it. Why? Because, you know, menstruation is a short sign she is not pregnant. If you ask the lady, are you pregnant? Maybe she's not aware. She's saying, doctor, yes, I'm not pregnant. But maybe she is pregnant, but she's not aware of it. During pregnancy, you cannot insert IUCD. If you insert IUCD during pregnancy, the fetus will die. You know, pregnancy cannot be continued after that. Okay, there will be reactions in the fetus. After, if the lady want to continue the pregnancy, she cannot continue. Got my point? So during menstruation, you are you are 100% sure that she is not pregnant. Number one. So you are safe that you are inserting IUCD in a lady who is not pregnant because she is menstruating. It is a proof that she is not pregnant. Number one, this is the reason. And number two, during menstruation, when the lady is menstruating, now the cervical canal is little bit dilated. So insertion is little bit easier. When you are inserting it now, you want the cervical canal to be dilated. So during menstruation, the cervical canal is dilated and insertion is little bit easy. Say yes if you got it. So best time is during menstruation, maximum up to 10 days. So this is how we insert with the help of an inserter. So the last contraception is our question right now, OCPs. Hormonal contraceptions, OCPs. What's the mechanism of action of OCPs? That is our question right now. What's the mechanism of action of OCPs? You know, there is a axis which is known as hypothalamus, pituitary. This is hypothalamus, pituitary and gonads. Okay, gonads. These are the ovaries, Okay, ovaries. So from hypothalamus, GnRH come. You know, gonadotropin releasing hormone. It will stimulate the pituitary. From the pituitary, FSH and LH come. FSH and LH. It will go to the ovaries. And when it will go to the ovaries, ovary में दो चीजें होंगी. Two things will happen. Number one, from the ovaries, estrogen will come out, number one. And number two, ovulation. Ovulation will take place. So for estrogen and ovulation, both of them, FSH and LH surge is required. Okay. And this estrogen will give a negative feedback here, negative feedback here. You got my point? This is physiological. I guess everyone knows it. Say yes. So in OCP, it's an oral pill. So the lady is taking with mouth, with water every day. It's a pill. It's an oral pill. It contains small dose of estrogen and progesterone. So you are constantly giving small dose of estrogen and progesterone. So it will constantly inhibit the GnRH and SH and FSH and LH. So FSH and LH will be less. So no ovulation. Till she is taking OCP, there is a negative feedback and she will not ovulate. No ovulation, she cannot be pregnant. This is the main mechanism. Got it? So two preparations are available. I guess everyone know Mala D and Mala N. I will provide this PDF and I request the people to learn the composition of Mala D and Mala N. You get questions on that. What is Mala D, Mala N? What is N and D? Acha, estrogen is same. In both of them, ethyl estradiol. But progesterone differ. In Mala N, the progesterone is norgestrol. And in Mala D, the progesterone is desogestrol. So N for norgestrol and D for desogestrol. How many of you are getting it? Say yes, respond. Are you finding it useful? So I completed the topic contraception. I know I require, I took 20 minutes to complete it, but I think it's worth. Because in 20 minutes, we secured one MCQ and I'm damn sure one MCQ is going to come from this topic. Maybe two if you are lucky. But one is definitely going to come from this topic. Take my words. Take my words. Can we go ahead? Everyone, please respond, people. Please respond. If you respond, my energy levels will be on another level. Okay, got it. So keep responding, keep talking, keep interacting, Okay. So before coming to the next topic, next question, let me tell you a thing. Exam do not test how much you have read. No. Exam test how much you have retained. You have read everything, but you have not revised. The key is the revision. You have not revised. If you have not revised, you will not retain. Once you enter in the examination hall, you have the paper, no matter how much you have read. No matter you have completed the books, you have watched the videos, you have done everything, but no matter you have not retained anything. If you have not retained anything, your answers will be wrong and you are not going to clear it. Got my point? So retention is important. कम पढ़ो लेकिन याद रखो. Okay, कम पढ़ो मतलब इतना पढ़ो कि syllabus complete हो, but उसको याद रखना है ना? याद रखना is important, so multiple revisions are required. Got it? Coming to the next question with this thought, coming to the next question. Next question is ultra important. What is net reproduction rate? NRR. If you want NRR to be 1, couple protection rate has to be what? Have you seen this question before? Repeatedly asked question. So for understanding this question, many students even don't know what is NRR. Ma'am, what is NRR? Net reproduction rate. What is GRR? Gross reproduction rate. What is TFR? Total fertility rate. So first understand these terminologies. If you understand these three terminologies, then I will tell you the next thing. What is couple protection rate? CPR. You have to understand all these. Listen. Yes, your answer is absolutely right. I guess most of the students know, but you can get different questions on NRR, GRR and TFR. So let me explain the three terminologies very quickly in a minute. What is NRR? What is GRR? What is TFR? First tell the full form. Let me tell you three terminologies. Net reproduction rate, NRR. Okay. Gross reproduction rate, GRR. And total fertility rate, TFR. Dekho, listen. Consider India. Imagine. We can take any country. Let's take India only. Imagine in India today a newborn girl is born. Not the boy. Girl baby is born. To a pregnant lady, she got delivered. And today a girl. So a girl is born here. A newborn girl. Newborn. And here also a newborn girl is born. Okay, इसको बाद में लेते हैं, ठीक है? A newborn girl is born here, a newborn girl is born here. Now, one day she will grow up, है ना? She will grow up. She will become fertile. When she will have menstruation, she will have menarche, she will have puberty. She will also get married. She will also have children in future, है ना? So she will also have children in future, na? So how many daughters she will have in future? How many daughters she will give birth in future? We are expecting. It's not reality. So a newborn girl in future, to how many daughters she will give birth? How many? Because we say the world is run by the females. Because females can become pregnant. Males cannot become pregnant. So ideally one girl should replace one girl. Before she dies, she has replaced hers. So the one girl should replace one girl by reproducing. It is an ideal situation. It doesn't happen. Some people have 10 girls. Some people have none of them. So ideally, one girl should replace one girl. So based on this concept, we are defining all this. Are you people getting it what I am saying? So a newborn girl in future, we are expecting that how many daughters she will give birth in future. If we apply current fertility pattern of that country, if it is India, we are applying Indian fertility pattern on this newborn. And if we are applying Indian mortality pattern on this newborn girl. So apply the current fertility and mortality pattern on this newborn and expect in future how many girls she will have. How many daughters she will have. So that is known as NRR. Say yes if you got it. So whatever country, we are talking about India. So apply Indian fertility and Indian mortality on this newborn. Imagine today a newborn girl is born in a hospital. In my hospital, one newborn girl is born. So I will apply Indian fertility and Indian mortality on her today. And I'm expecting she will reside in India only. She will not move on in some other country. She will reproduce here only, get married here only, die only here. So I'm expecting her complete life. I'm expecting in future, nobody knows she will move out to some other country. Got my point? So currently I'm applying the Indian fertility and mortality on her and looking how many daughters she will give birth in future. That is NRR. Say yes if you got it. Say yes if you got it. What is GRR? GRR is exactly same. Here also we have a newborn girl. We are expecting how many daughters she will give birth in future. Exactly same. You will say, then what is the difference? Here we are applying only current fertility pattern of the country on that girl. We are assuming no mortality. We are assuming, but it is not a good indicator. Everyone have to die. Jo aaya hai wo jayega. Spiritual lecture. Everyone, I will also die. You will also die. Everyone who is surviving on the earth will die one day. So mortality is the fact. We have to accept it. Fact hai. So it is not a spiritual lecture. Chalo, come on. But mortality consider karna hai. Here we are neglecting mortality. So NRR is a better indicator. GRR is not as good as NRR. But here we are taking only fertility indicators. We are neglecting mortality. So that is the only difference. Both of them, the definition is same. The definition is a newborn girl in future, how many daughters she is giving birth. If you are applying the current fertility or fertility plus mortality. Say yes if you got it. Say yes. Interact. Say yes. And the third TFR. TFR is total fertility rate. Here also newborn girl is there. Today born. A newborn girl born today in India. So how many total children she will have in future? Not only girls. I'm saying boys and girls both. sons and daughters both. How many total children she will have in future? That is known as TFR if we are applying only current fertility, no mortality. So we are taking mortality only in NRR. First say how many of you got it? Acha. Reverse question, vice versa. How many of you didn't got it? How many of you didn't got it? So there are three terminologies, NRR, GRR and TFR. This is the simplest way I can explain you. This is net reproduction rate, gross reproduction rate, total fertility rate. In all of them, there is a newborn girl and we are expecting, it's not a reality. We are expecting in future how many girls, daughters she will give birth, how many daughters she will give birth or how many total children she will give birth. But what we are applying on her, that matters. We are applying fertility तो करना ही पड़ेगा ना. You are seeing the reproduction, so you have to apply the fertility, current fertility indicators of India. But if you are applying mortality also, it's NRR. In other two, mortality we are not considering. I hope you all got it. So learn the three definitions, you understood it. You get many questions on that. Hana? So a newborn girl is there. In future, how many daughters she will give birth? But we are considering fertility and mortality both. So it is NRR. Okay. And GRR is same. The newborn girl, how many daughters she will give birth in future. But we are assuming no mortality. We are assuming only fertility, but no mortality. Here we are assuming both. Here we are assuming only fertility, no mortality is GRR. And what is TFR? It's complete family size. The newborn girl in future, how many total children she will give birth? Not only girls and boys both. Daughter and son both. So how many total children? So it is the complete family size. How many of you are getting it? Huh? Okay, so that is the thing. Now listen. Let me tell you one more thing, couple protection rate. Okay, now what I want NRR to be 1. What do you mean by NRR 1? I want GRR also to be 1. Ideally, it's not there in India. In India, it's more than 1. Okay, what do you mean by 1? 1 means one girl will give birth to one daughter. One girl will give birth to one daughter. One girl is replacing herself. That's it. This is the ideal situation. And what is TFR? TFR should be 2. One girl should give birth to 2 children. One girl boy, one daughter and one son. Hum do, hamare do. है ना? One girl is replicating herself and she should have son also. So this is TFR. TFR should be 2. Ideally. Every couple should have 2 children, out of which one daughter, one son. It is ideal. Say yes. So can I say, you see the value here, it's 1, here it's 1, here it's 2. So can I say that NRR or GRR is equal to half of TFR? It's a question. Chalo, it's a question. Mark it. Yes, learn it. Ideally. Because ideally this value should be 1 and this value should be 2. 2 will cancel each out and it is 1. So please learn NRR and GRR is equal to half of TFR. How many of you got it? Currently NRR is not 1. In India, the NRR is more than 1. Anna, let's talk in terms of NRR because it is the best indicator. Anna, I want NRR to be 1. In my country, in India, I want to make NRR to be 1. How I can NRR to be 1? Currently, one newborn girl is giving birth to more than one daughters. Ideally, she should give birth to one daughter. One girl should give birth to one daughter, but one girl is giving birth to more than one daughter. So if you want to make it 1, if you want the NRR to be 1 is equal to 1, you have to reproduce the reproduction. I mean, the couple should use contraception during sexual intercourse. So how many total couples are there? How many total? So you have to learn in a couple, okay. In a couple, there is a husband, there is a wife. Everyone knows, the male partner and the female partner. Okay, so reproduction depends on the female age. From 15 to 45 years, this is the reproductive age of the female. Here the menarche, here the menopause. During the 30 years, the female can reproduce. Male can reproduce always. There is no age limit. I mean after puberty till death. Okay, so here the couple in which, such a couple in which the wife is in reproductive age, such a couple is known as effective couple. I am not interested in all couple. I am interested in the couple to which the contraception. So in all the couples in which the wife is in reproductive age, they should use the contraception during sexual intercourse. So such a couples are known as effective couples. So among all effective couples, jitne bhi effective couples hain, all effective couples, if 60% of them minimum use contraception during sexual intercourse, NRR automatically will become 1. That is our question right now. So this is known as couple protection rate. How many couples are protected via contraception? So that is couple protection rate. Say yes if you got it. Say yes. Yeah, one of the 4 methods. Absolutely right. Charanjeev, one of the 4 ideal methods are either condom or IUCD or OCP or termination method. That is vasectomy or tubectomy. So one of the 4 methods they are using during sexual intercourse. So if at least 60% of the couple in India, currently not even 60% are using contraception during sexual intercourse. If at least 60% minimum, more than that, if minimum 60% of the couples are using contraception during sexual intercourse, NRR automatically will become 1 and it is known as balanced. It is known as balanced. Everyone give me a thumbs up. Everyone give me a thumbs up if you all got it. Okay, so this is the concept and you got many questions on that. You may be thinking, madam is giving so much time on one question, but in one question, I'm covering 20 questions actually. Okay, so please understand the concept. So I want NRR to be 1. For that, the CPR should be more than 60. Couple protection rate should be more than 60. And NRR and GRR are half of TFR. It's also a PYQ. So please learn that. Coming on the next question, next topic quickly. Chalo, read the next question. Chronic malnutrition is assessed by. How we assess the chronic malnutrition? It is weight by height, height by age, weight by age, or mid-arm circumference. Oh my God, so much confusion. What do you mean by that? So please understand malnutrition. Please understand malnutrition. Acute, chronic, and acute and chronic. So there are 3 types of malnutrition. Please understand. Malnutrition. Then I will explain you. First understand malnutrition. There are 3 types of malnutrition. Okay. One is acute, one is chronic, and one is acute and chronic. Okay, first understand from the basic. Okay, assume you don't know anything. Listen, what is acute malnutrition in a child? Imagine a child who belongs to a well-to-do family. He's eating well, the weight is good, the height is good, and the parents are feeding the child regularly. The child belongs to a well-to-do family. He got kidnapped. Suddenly he got kidnapped, or the mother is dead, or there is some emergency situation in the family, and child is not getting the food since last 1 week, maybe since last 10 days or 2 weeks, the child is not. So it is acute malnutrition. So you answer, in such circumstances, the weight will fall first or height will fall? Weight will fall or height will? Height once gained, it cannot fall again. Whatever height gained, this child cannot, short. Once whatever height gained, it cannot short. So weight can reduce. So in acute malnutrition, the weight will reduce. The weight will reduce. You got my point? Say yes if you got it. So the formula of acute malnutrition is weight. Reduce weight as compared to height. The height is normal. As compared to height, the weight is reduced. This is indicating acute malnutrition. So weight upon height. It is known as wasting. Absolutely right. It is known as wasting. It is known as wasting. The weight will fall. Now, this is a circumstance. It is acute. Acutely, the child is not eating the food. Since last 1 week, 2 weeks. Before that, it was all right. That's why it's acute. The child got kidnapped or any condition. Now, chronically, child belongs to a poor family. They don't have money to eat since the childhood. He is not getting the food. See, since the birth, he is not getting the food, getting less food. So you tell me what will affect. Here the weight will affect or height will affect. Here height will affect. The child will be short in height. He'll be short. The ideal height is not gained. In that age, whatever the height should be, in that particular age, whatever the height should be, in that particular age, that height is not gained. The height is less. So less height for that age. So here the height will be affected. Here the weight is affected. Common sense now. If I will not eat food for next 2-3 months, for next 2-3 weeks, so my weight will fall. But if someone is not getting food from the birth, the height will not grow properly. Got it? So height is an indicator. So yes, it is known as stunting. It is known as stunting. Okay, this was wasting. This was stunting. Okay, this is chronic malnutrition. And acute and chronic, divide the two. Common sense, divide. Acute is the numerator, chronic is the denominator. Let's divide. Chalo. What is acute? Say, ma'am, weight upon height. You see, this is. And divided by chronic. What is chronic? Height upon age. So height cancel. Height cancel. So it is weight upon age. So I don't learn these formulas. Frankly speaking, I don't learn. I understand and this is how I derive on the spot. Okay. If you try to learn the 3 formula now, acute, chronic and acute on chronic, you will forget. So what is acute malnutrition? That is wasting. It is weight upon height. Okay. And what is chronic malnutrition? Chronic malnutrition, that is known as dwarfing or stunting. It is height upon age. And what is acute on chronic? Divide the two. So height will cancel each out. It will be weight upon age. How many of you got it? We got it. Why don't we revise it again? Quickly. Be fast. Come on. Acute malnutrition. Okay. Chronic malnutrition. And acute on chronic malnutrition. Revise. What is acutely affected? I always remember acutely weight is affected. Weight is less as compared to height. So weight upon height. Chronically, height is affected. If someone is not eating food for many years, height will not grow. Okay. So height upon age. Height will be less as compared to age. Okay. We compare weight with height. We compare height with age. And acute and chronic, height will cancel. So it's weight upon age. I guess you will never forget now. Say yes. Say yes. So see your question right now. What they are asking? They are asking for chronic. So my answer is height upon age. Okay, my answer is height upon age. My answer is B. But if I change the question to acute in the same question, my answer will become weight upon height. And in the same question, if I change the question again, acute and chronic, my answer will become weight upon age because height will cancel. So 3 questions in the same question. Can we go ahead? Can we go ahead? Next question. One of the question from the nutrition. Methionine is a limiting amino acid in what? Is it a limiting amino acid in cereals, maize, wheat, or pulses? Huh? Have you heard about the limiting amino acid? What is limiting amino acid? Limiting amino acid is particular amino acid is absent in that particular food. Particular food item do not have that particular amino acid. So you have to learn the combinations. What is the correct answer here? Huh? The correct answer is not A. The correct answer is the pulses. Okay, I guess you got confused. Many students. Okay, listen, learn the combination. Okay, cereals. What are cereals? Cereals means rice and wheat. है ना, राइस एंड व्हीट. हिंदी में कहूँ तो चपाती खाते हैं ना व्हीट का, है ना, आटा, गेहूं और चावल. So rice, wheat, this is cereals. Cereals. Okay. What is pulses? Pulses मतलब दाल. Hindi में it is known as dal. Okay. You can see these all are dals. These are pulses. Okay. And the third is the maize. What is maize? Hindi में तो उसे भुट्टा कहते हैं. I don't know what you call. It is भुट्टा. Have you seen the maize? This is maize. Okay. So learn one amino acid. Actually 2, but you can learn the main one, which is limiting. So in cereals, you can learn threonine is absent. Threonine is absent in the cereals. In pulses, methionine is absent. Methionine is absent in the pulses. And in maize, tryptophan is absent. Now, how to learn? I don't have any mnemonic. Unfortunately, if you have, please share. I will share with everyone. Do you have some mnemonic? I learned like this. CT. In the cereals, threonine is absent. PM. है ना, PM. Pulses में methionine is absent. And empty. Maize में tryptophan. Maize में. I learn like this. If you have some better mnemonic, why don't you tell me? Threonine absent in cereals. Threonine. Yes, absolutely right. Some mnemonic. Can you write again? Jatak. Have you given some mnemonic? मक्का ट्रॉली में ले जाते हैं, रोटी थाली में खाते हैं. Okay, let me see. Okay. So, good one. Who is this one? Jatka have given a mnemonic. Let's try. So, we don't have any confusion in the pulses. Pulses to methionine hai, but we have confusion in the T and T. Here threonine, here tryptophan. So, you will get confusion in T and T. So, one is absent in cereals, one is absent in maize. So, how to learn? Cereals में threonine से you can learn थाली, है ना, we eat थाली में we eat cereals. So threonine is थाली, है ना, I guess this is what he mean to say. Okay. And maize में tryptophan trolley, we take maize in trolley. This is thali, this is trolley. So you can learn, at least you can get a clue. Okay, so good one, thank you. So what we have learned, what is missing in cereals? You tell me. What is missing in pulses? Tell me. And what is missing in maize? Tell me. So first write down the pulses, no confusion. PM, Prime Minister you can learn. है ना, methionine is absent. PM you can learn. Now here we have confusion in T and T. Both are T and T. CT, MT. Both are T and T. But how to learn which T and which T? How to learn? So here यहाँ से थाली यानी threonine. And यहाँ पे trolley, tryptophan. So thali and trolley. Good one. Okay, I got it. So can we go ahead? Give a thumbs up if you got it. Okay. Can we go ahead? भुट्टा ट्रिप में खाते हैं. This is also good one. So tryptophan is maize. भुट्टा ट्रिप में खाते हैं ना. मैंने we go on a trip, we eat भुट्टा. So this is also good one. Very good. Thank you so much. So share with everyone. Okay. Good one. Good. So however you learn, but learn it. You get questions on that. So they are asking methionine is a limiting amino acid. So answer is pulses. I can change the question. The question will change frequently. Coming on the next question. You frequently get questions on the breastfeeding. There are many important things you have to notice in the breastfeeding. First, give me the answer. Exclusive breastfeeding. Everyone knows. Up to 6 months, nothing has to be given to the newborn. Nothing has to be given. Nothing means not even water. Not even. The grannies give the water and all. No, nothing. No food, no water, no honey, nothing has to be given. Only breastfeed. Breastfeed will provide everything to the newborn up to 6 months. After 6 months, other things are started. So from the breastfeeding, what all questions are important? Breastfeeding Breastfeeding is a beautiful process that brings a bonding between the mother and the kid. It's a beautiful process. It should be started within 30 minutes after vaginal delivery, and it should be started within 4 hours after cesarean section. Because in cesarean section, obviously the anesthesia is given to the mother. Once the mother wake up out of the anesthesia, she's in the recovery room. So within 4 hours it should be started. So learn the cutoff. In normal delivery, it should be started within 30 minutes, and in cesarean section, it should be started within 4 hours. Now, whenever you are thirsty and hungry both, I'm hungry also, I'm thirsty also. So what do you prefer? In front of you, food is also there, water is also there. What do you prefer? You want to satisfy your hunger first, or you want to satisfy your thirst first? Obviously, we want to satisfy thirst first. Obviously, everyone do so. कि पहले पानी पियेंगे फिर खाना खाते हैं. Because resisting thirst is difficult. Resisting hunger is easy. So if this kid is also, the child is also thirsty also and hungry also. So God has given physiologically in this manner only. As soon as the child, the newborn, starts sucking the nipple of the mother, as soon as, so the first milk which is coming is known as foremilk, and later on it is very thin. It's watery in consistency, and it's contain carbohydrate, sweet water, to satisfy the baby's thirst. It contains maximum water, mineral water. It contains sugar. Okay, but later on it keep on sucking, so hind milk will come. Hind milk is rich in fat to satisfy the baby's hunger. You got it? What is foremilk? What is hind milk? So foremilk is to satisfy the baby's thirst. It contains water and carbohydrate. Meetha pani. It's like a sweet water. And later on, the baby keep on sucking. The hind milk will come, which is rich in the fat to satisfy the baby's hunger. So this is the funda of the foremilk and the hind milk. You got it? Now what is the storage of the breast milk? Now if the mother is available for the 6 months, every 2 to 3 hours, she has to feed the baby. It is not on clock. Looking at the clock, it is every 2 hours. She's making an alarm. No. When the baby is hungry, the baby will cry. When the baby is hungry, the baby will cry automatically. So it is feeding on demand, not feeding on clock. We don't promote feeding on clock. Now, we ask the mother to feed every 2-3 hours, but it is not keep looking at the clock she is feeding. Whenever the child is crying, feed that time. Okay, this is the thing. But mother should be available all the time. Maybe the mother is working. She joined the work back. She is not free. Or maybe the mother is died during delivery, unfortunately. Maybe the mother is divorced and the newborn is not with the mother. He's with the father. So many situations can arise when the mother is not available. In such situation, what to do? We want to breastfeed the baby. Still, we want to breastfeed the baby. So storage of the breast milk can be done. For example, the mother is working. So in the morning, before she leaves for the work, she can do the expression of the breast milk and she can store it. So at room temperature, it can be stored for 10 hours. In fridge, we have fridge and we have freezer. In the fridge, the temperature is 2 to 8 degrees. In the freezer, the temperature is up to minus. It is in minus 20. So in the fridge, it can be stored for 24 hours. In the freezer, it can be stored for 3 months. In the 3 months, we have blood banks now. We are on blood is available in the blood bank. Whosoever requires the blood of whatever blood group, it's available in the blood bank, although it's paid. It's monetary charge. In the same way, nowadays in many cities, the breast milk banks are also available, where the mothers who have extra milk after feeding their baby, they can express and they can donate it to the bank, so that babies who don't have the mothers, whose mothers are dead or the mothers are not living with them, they can get, although it's paid. So breast milk banks are also available, where we do the storage at minus 20 degrees for 3 months. You got my point? So you have to learn the temperatures basically. You get questions on the temperature. So learn at room temperature, how many hours? In the fridge, how many hours? And in the freezer, here in the fridge 2 to 8 degree, and here minus 20 degree. How much time? Here it is for 10 hours, 8 to 10 hours. Here for 24 hours, and here for 3 months. You say it is for the banks, breast milk banks. I hope you all got it. Say yes, you get questions on that. Now compare the mother's milk with the cow's milk. The human mother's milk, the breast milk with the cow's milk. Now, sometimes there is a real confusion. There is a taboo that cow milk is more nutritious. Now there is a newborn born today. Newborn. And the granny, the grandmother of this newborn, the fundas are given by grannies usually. The granny, the nani, dadi. So they are saying, no, don't give the mother's milk. Cow's milk is more nutritious. So is she right? No, she is wrong. Cow's milk is not more nutritious. See, now compare the cow's milk with the mother's. There is a taboo in the society. So you should be aware of that. Mother's milk contain more lactose. Lactose is the sugar. You can see. Don't learn the values. Just see. So mother's milk contain more lactose. But the fat, protein, calcium, everything else is more in the cow's milk. Yes, you are right. It is more in the cow's milk. Only iron and lactose is more in the mother's milk. So you are saying, Kid, ma'am, you said that mother's milk is more nutritious. Cow, we are seeing that mother's milk contain only lactose more, but rest all the things are more in cow's milk. So my granny is right, no? Granny is saying that grandmother is saying that cow's milk is more nutritious. So she is right. No, no, no. Cow's milk is containing everything more. I agree. I agree. But actually, cow's milk is for calf. Whose calf? The baby of the cow. And mother's milk is for the baby of human. है ना? Mother's milk for the newborn, the human newborn. है ना? So God has given cow's milk for the calf and the human. You know, I'm not teaching you towards the vegan diet. Please don't take me otherwise. What I mean, all this is more. I agree. But human baby digestive system is not strong enough to digest it. So don't give cow's milk to a newborn. Give mother milk only. Although it contains less, but it is good to have less because the digestive system is not developed yet. You cannot give more protein. The digestive system, the intestines are not developed. Okay, don't give fat. Don't give too much calcium. It contains an excess. You know, the child cannot absorb it. The newborn human baby cannot absorb it because digestive system is not mature till, not developed completely till. Say yes if you got it. So I agree that nutrition-wise, cow milk is more nutritious, but it is not good for human baby. The two things are paradox, but I'm saying it together. I don't know how many of you got it. Got it, Hannah? So please learn lactose is more in mother's milk. It's a question. But remaining all the things are more in cow's milk. Remaining all the things. Protein also, fat also, and calcium also. Please learn that. Hannah? Now we will compare the four things. Listen, what do you eat? You eat, of course, food. In your food, you have calories. Hannah? You get calories from three things in the food. What do you have in your dinner? Huh? We eat carbs, we eat protein, and we eat fat. We eat three things in our food. Hannah? Either we are eating carbs or we are protein or fat or a mixture of all three in our diet, in our thali, in our diet. Hannah? So you tell me in the four things that carbs, protein, fat, and calorie. Compare the four things. In four milk, Hannah, we get milk from the buffalo. Hannah, we get milk from the goat. We get milk from the cow. And this is the human milk. For baby, which is the best one? For baby, which is the best one? Compare the nutrition-wise. For the newborn, nutrition-wise. Buffalo, goat, cow, and human. Okay. So fat, protein, and calorie, the sequence is same. Buffalo is having maximum fat, protein, and energy, followed by goat, followed by cow, followed by human. So you can make a mnemonic. Buffalo, goat, cow, human. Hannah, this is the sequence. So maximum fat, maximum protein, maximum energy is present in buffalo. And minimum in human. But still, don't give buffalo milk to the newborn. Give human milk only. Although it is having minimum fat, minimum protein, minimum energy, because it is enough for the newborn. If you give it more, lalach karoge na, if you are greedy, the digestive system is not enough to digest it. Hannah, so don't become greedy in that case. Got my point? Hannah, make a mnemonic. You have some mnemonic, you can share. Bhai Goa chalte hain. This is one of the mnemonic one of the student only told me in the last class. If you have some better one, you can tell me. So BGCH. I want you to learn BGCH. BGCH. You can tell me some better mnemonic if you have. Otherwise, Bhai Goa chalte hain. It's a Hindi mnemonic you can learn. So it is buffalo, goat, cow, human. So this sequence is good. So for the protein, for the fat, and for the calorie. But what about lactose? In the lactose, human is number one. Human को यहाँ से काट के यहाँ पे लगा दो. So human followed by buffalo, goat, and cow. Buffalo, goat, and cow. So human is coming on number one in case of lactose. You got my point? How many of you got it? So tell me the sequence for calorie, sequence for protein, sequence for fat, and finally the sequence for lactose. Who will tell me the four milk? Buffalo milk, goat milk, cow milk, and human milk. Human milk is the breast milk. Huh? Tell me the sequence. So here, bhai Goa chalte hain. This is the sequence. The same sequence here, the same sequence here. But in lactose, the human will come number one. So human followed by BGC. So this is the sequence. You get many conceptual questions over here. Can we go ahead? Can we go ahead? Okay. Say yes. Say yes. Can we go ahead? Yes, I will provide the PDF after the session. The next question is in front of you. Registration of birth should be done within how many days? According to the rule, according to the law. Civil registration law. Is it within 15 days, 21 days, after 21 days, before 21 days, or within 30 days? The registration of the birth. What is the correct answer? Most of the students are saying B. Huh? After 21 days or before? Within 21 days. You got confused. Not B. The answer is C. No? Within 21 days. Hannah, today a newborn is born. So within 21 days, you have to register the birth. Otherwise, you can do it after birth also, but there will be a penalty. There will be a late fees. Late fees or penalty. If you're doing within 21 days, it's free of cost. It's free of. So you don't have to physically go anywhere. There is a website. The name of the website is Civil Registration System Birth and Death Registration Act. It is the Birth and Death Registration Civil Registration System, CRS. S system, है ना? So according to this, the birth must be registered within 21 days. The death, if someone is having death at their home, someone relative, someone, it should be registered within 21. So birth and death both are registered within 21 days. Marriages vary from place to place, but in most of the places in India, it is within 30 days. So marriage should be registered within 30 days. These are the new guidelines. According to the old guidelines, birth should be registered in 14 and death within 7. These are not followed. So I'm just telling you, if you are there, these are coming in the option, don't follow it. So tell me the new guidelines. Birth should be registered within how many days? Death should be registered within how many days? And marriages should be registered within how many days? Tell me. Birth is within 21 days. This is also within 21 days. Death is also, marriage within 30 days. So learn the guidelines, the latest, the new guidelines. Say yes if you got it. And if the late, after this there, so late fees is there, and within 21 to 30 days, after 30 days till 1 year, a written permission from the district registrar is required. And after 1 year, along with the late fees, order from the executive magistrate is required. So you have to make an affidavit for that. Okay. Coming on the next question, reference weight for Indian man and Indian women. What is the reference weight of Indian man and Indian women? Say yes. Say something, people. Say something. Reference weight for Indian man and women? Yes. What is the correct answer? Yes, you are right. So learn the definition of a reference Indian female and reference Indian male. So there are 5 criteria. You have to learn the 5 criteria. Currently the question is based on age, so it was very easy. So age is different in both of them. For man, the age is 65. I'm sorry, the weight. Age is same in both of them. It is 20 to 40. I learned 20 to 40. Minus 1, minus 1. 20 minus 1 is 19. 40 minus 1 is 39. So 19 to 39. You can learn 19 to 39. Yeah, you can learn easy way 20 to 40. So age is same in both of them. But weight is different. The man should have 65 kg. The Indian female should have 55 kg. So Indian female should have 55 kg of weight and Indian male should have 65 kg. So these are the new guidelines. Initially female was 50, but now it has changed. In the new guidelines, it's not 50, it is 55. So 55 and 65. Currently question is on weight. So it is 55. Okay, the question is wrong. It should be ideally 65 here. 65 is not given in the option. It should be 55 and 65. So please learn it. Please learn it. Yes, it should be 65. Yes. So 55 and 65. Height is also different. So females are a little bit shorter and males are a little bit taller. So here 1.62 meter in female and 1.77 meter in male. You can see 1.62, 1.77. You have to learn it. And BMI is more in females. Age is equal. Weight is more in man. The height is more in man. Okay, but BMI is more in woman. BMI is more, basal metabolic index is more in women. Okay, so it is 20.95. And here it is 20.75. I told you today only BMI in the initial session. What is the normal value of BMI? 18.5 to 25. This is normal BMI. So here reference range, you can see it's 20 point, but 20.95 and 20.75. And the person should be free of disease. It should be doing active work for 8 hours, sleep for 8 hours, 4 to 6 hours of moving and roaming around, 2 hours of recreation. Such a person is reference Indian male and reference Indian female. So please learn the definition of reference Indian male and female. You have to learn the age of both of them. You have to learn the weight of both of them, height of both of them, BMI of both of them, and others. Others are easy, but learn the values. How many of you got it? Can we go ahead? You get the question on BMI and this height also. So don't neglect it. Please learn. So the next question, ultra important. Okay, how much additional calories per day is required in a pregnant lady? How much calories are required in a normal lady, non-pregnant? How many additional calories are required in a lactating lady? How many calories are required in a male? What is the correct answer? First you guess. Yes, the correct answer is 350 kilocalorie. So it's time to learn the calorie requirement. What is your calorie requirement? Calculate yours. Do you know how much you should eat per day? How much kilocalorie you should eat per day? Or you are just eating like this? How much kilocalorie I require per day? So it depends which type of person you are. Are you a sedentary person? Are you a moderate working person or you are an intense worker? If I talk about me, I'm a moderate working person because most of the time I'm sitting on a chair and taking the classes, taking lectures or just reading something, sitting in front of laptop most of the time. So I'm not much sedentary, but I take a little bit of exercise in the morning. I do a little bit of exercise. So I'm a moderate. I will put myself in moderate. Intense workers, they do much of the jogging, running, and I don't do so. So depend on which category you belong. So first decide your category. And then everyone knows their gender, the person. We are dividing into 4 categories. So first, male. और 3 टाइप ऑफ फीमेल है ना, नॉन प्रेग्नेंट फीमेल, प्रेग्नेंट फीमेल और lactating female. So females are of 3 type, but males are males only. So males and the 3 type of females. So I will tell you these guidelines, है ना. What about the sedentary worker? What is the requirement? What is the moderate worker? What is the requirement? And what is the intense worker? What is the requirement? So it depends on 2 things. Number 1, which category you belong in case of working, and what is the gender. What is the gender? Is it male or female? If it is female, it is non-pregnant, pregnant or lactating. So we will make this chart right now. We will make it. Okay. So this is a chart in front of you. So these are the latest calorie requirement guidelines, the new guidelines which are updated in 2020. Before that, old guidelines, please don't follow it. In some books, it's still given, but don't follow that. Follow the new one, which are given by NIN, Nutritional Institute, है ना, National Institute of Nutrition, Hyderabad, NIN ICMR guidelines. We will follow that. So please see for the male. We will just learn for the male. है ना, the 3 type of male: sedentary, moderate or heavy. For the male, it is 2100. Learn the first 2 digits: 2100, 2700, 3400. Say again: 2100, 2700, 3400. है ना. For the female, learn only first one. It's 1600. What about the other 2? Here it's 2100. है ना. And here it's 2700. So a sedentary worker, a sedentary male is equal to moderate female. A moderate male is equal to intense female. You are getting my point? You are getting my point? During pregnancy, whatever is the female, additional 350. If the female is this one, 1600 plus 350, don't do it. Do it on spot. If you do it right now, you will forget. If the female is moderate, 2100 plus 350. If the female is intense worker, 2700 plus 350. So additional 350 in whatever. Now in whatever trimester, in the first trimester also, second trimester also, third trimester also, additional 350 kilocalories are required. Okay. During lactation, now the mother have to eat more because she have to synthesize the milk for the baby. So she has to eat double, one for herself and one for the baby, because she is giving food to the baby also by doing exclusive breastfeed. So during the first 6 months, she should take additional 600, which is more than even pregnancy. In the pregnancy, only additional 350 is required, but in lactation, first 6 months, additional 600, she should eat more, है ना? So 1600 plus 600 or 2100 plus 600 or 2700 plus 600. And later on, after 6 months, baby do not require much breast milk because you have started the weaning also. है ना? Weaning is additional food. So only 520 kilocalories are required. So can we revise it quickly? Can we revise it? Can you help me in making this table? So tell me the sedentary, moderate and intense worker. है ना? Tell me these guidelines for male, for non-pregnant female, for pregnant female and for lactating female. Who will tell me? First learn for the male. 2100, 2700 and 3400. I learn like this. Here I learn 1600 and I put 2100 here. I put 2700 here. In all the trimester of pregnancy, additional 350. So plus 350 plus 350 plus 350. In lactation, during the first 6 months, it's 600. So plus 600 plus 600 plus 600. The later on 6 months, it's 520. So here plus 520 plus, so it is additional. It is over and additional. How many of you are getting it? So please have to learn the numbers, but I have simplified it. At least I have simplified it. So I'm asking in a pregnant lady. So answer is 350. Hana. If I ask in a lactating lady, and that too in the later 6 months, 6 to 12 months, so answer will be 520. If I ask during first 6 months, the answer is 600, which is not given in the option. So you frequently get questions on that. Give me a thumbs up, people. You got it. Say yes. This is the calorie requirement. Okay, the next question, I guess, is the last one. It's already 12:20. It's happening. You want to sleep or you want to study more? How many of you want to study more? Huh? It's already, we are late now. Anyways, chalo. An IQ of 55 comes in which category? We are talking about the mental retardation. Profound, mild, moderate or idiot. We are talking about mentally retardation. That depends on the IQ. You know what is your IQ? How to calculate the IQ? What is IQ, by the way? It is intelligence quotient. That is IQ, the full form of IQ. So I will come on the question again. Let me explain you what is IQ. IQ of a person. That is intelligence quotient. The first time this test was performed by Binet and Simon. Okay. So the formula of IQ is in front of you. The formula of IQ is mental age upon chronological age into 100. What is your chronological age? Your actual age. Your actual age. What is your actual age? Maybe 18 years, 20 years, 22 years, whatever is your age. Whatever is my age right now. The current age is our chronological age. But it is not necessary that our mental age is synchronizing with that. Usually it should synchronize. If I'm 10-year-old, my mental age should also be 10 years. If I'm 20-year, mental age should also be 20. If I'm 30, the mental age should be 30. It should be. But sometimes the mental age is ahead I am 10, but my mental age is like 20, like 30, है ना? Or it should be lagging behind. I am 10, but my mental age is like a kid 2 year, है ना? So it can be ahead, it can be lag, or it can be synchronous. You got my point? You got my point? So that is the formula of IQ. That is the formula of IQ. How to calculate the mental age? For calculating the mental age, certain test has to be performed by the psychiatrist. Hana, you know your chronological age, but you don't know mental age. If you don't know your mental age, you cannot calculate your IQ. And multiplier is 100. How many of you got it? Now imagine, what is the formula? Say it, jaldi bolo. IQ is equal to mental age upon chronological age into 100. If they cancel each out, answer is 100. So normal IQ is 100. Anna, if the mental age is equal to chronological age, they will cancel each out. And answer is 100. Na? So 100, normal people have 100 IQ. So plus 10 minus 10 chalta hai. Take 90 to 110. 90 to 110 is normal. Anna, ideally it should be 100. Plus 10 minus 10. Anna, so normal IQ is 90 to 110. Please learn that. If you know normal, things will become easy. Hana, you don't have to learn the normal. From the formula only you can calculate. Just cancel the mental age and chronological age with each other. So answer is 100. So plus 100 plus 10 minus 10. Plus 10 minus 10 is 90 to 110. That is normal. That is normal. Hana? So 110 ke upar we are having three categories. Superior, very superior, near genius. If someone's IQ is 110 to 120, the person is superior. We call the person superior. 120 to 140, we call the person very superior. And 140 above, we call the person near genius. There is no one genius in this world. The maximum category we have is near genius. There is no one genius. There is no terminology like genius. Use the term near genius. Hana, near genius is 140 above. Hana, so here we have three category, but below we are having 5 category. Below normal. Hana, so idiot is someone whose IQ is up to 25. Just 25, 0 to 25. You can call that person idiot. Hana, idiot. Okay, the next is imbecile. If the IQ is between 25 to 50, you can call the person as imbecile. You can call the person moron. Moron if the IQ is 50 to 70. Okay, borderline is 70 to 80 and low normal is 80 to 90. How many of you got it? Can we write it? It's easy. It's easy. Take it easy. So start with normal. Hana? With normal, if you know the normal, things are easy. It's 90 to 110. It's normal. Above the normal, we are having three category. Hana? Superior, very superior, and near genius. Near genius. Take care. You can make it out. And below that, we are having 5 category. 1, 2, 3, 4, 5. Below that. Okay. One is idiot. The first one. Hana, the worst are the idiots. Okay. The second are the imbecile. Okay. Better than the idiots. Imbecile. The morons are still better. Okay. After that, borderline are there. And after that, low normal is there. Hana, you can make it out. You can make it out. So start. So idiot is 0 to 25. Hana, imbecile is 25 to 50. Moron is 50 to 70. Borderline is 70 to 80. And low normal is 80 to 90. 90 to 110 is normal. 110 to 120 is superior. 120 to 140 is high superior. And more than 140 is near genius. This is what we have to do. So you get questions on that. Number 1, maximum questions come on moron, imbecile, and idiot. So learn these 3. Maximum questions come on that. Okay, number 1. Number 2, what is the range of mental retardation? For mental retardation, more than 70 we consider normal. Abhi normal kya tha? 90 to 110. 92. But for mental retardation, more than 70, anything is normal. Hana, below 70 is mental retardation. We divide mental retardation in 4 categories. Mild mentally retarded, moderate mentally retarded, severe mentally retarded, and profound mentally retarded. Someone IQ below 20 is profound retarded. Profound. 20 to 35 is severe retarded. 35 to 50 is moderate. And 50 to 70 is mild. So what they are asking in the question? They are asking 55 comes in which category? 55. So it is mildly retarded. Can you see 55? It is coming here. 55. So 55 is mildly retarded. Hana? For idiot, it should be 0 to 25. Okay. So this is how you can crack this question. Okay. Got my point? Okay. So this is the thing. Okay, G. So can we stop now? Few more questions are there which are from the PYQs. I guess most of them we have covered. The latest one we have covered, but many questions are ahead. I mean, few more questions are ahead, but many we have covered. So how you found the session today? Was it useful for you? Say something. Just give me a minute. So thank you so much for your cooperation, for your time, for your patience. And I just want to wish you best of luck for your exams. Thank you so much, and just want to wish you best of luck for your exams. Once you cracked your FMG, don't forget to ping a message to the team or to anyone in the team and just tell us that you got selected. I mean, you have cracked the exam. Okay. And cracking FMG is not an end, it's a beginning. It's a beginning. You are just getting a license to enter. It's a beginning. And after that, you have to prepare for your main competitive exam, maybe NEET PG, maybe INICT, maybe PLAB, USMLE, whatever you are targeting. Okay. And you all are going to become super, the best doctors, the best physicians, the best doctors, the best surgeons in the world. I know that. I have trust in you. Before becoming a good doctor, try to become a good human. If you're a good human, you automatically will become a good doctor. Okay. Okay. Thank you so much. Wishing you best luck in life, and just study. It is you are just about to, the things are going to happen just in near future. So your exams a few days ahead. Few more days you have to survive with the same settings. Few more days. It is the darkest of the tunnel. The light is about to you can see the light is about to there. Okay, got it. So study hard. Wishing you all the best. I hope you found the session useful. Okay, if you found the session useful, don't forget to click on the like button. Share with all your friends, colleagues. Thank you so much. Bye bye. Wishing you all the best. Good night. I'm just ending the session. Bye.